Just to get everybody back online and back in their thinking about education, we finished up with K-3 literacy. Had a bill draft that we worked through. We worked through the Imagination Library, and we also just finished up with the resourcing of literacy, statutes. Oh, actually, no, we didn't. So that's where we are at. We have resourcing of literacy statutes with Megan Degenfelder and Shelley Hamill. Madam Superintendent, how are you doing?
Well, if I could, there we go. Good afternoon, members of the committee. Megan Degenfelder, State Superintendent of Public Instruction. We won't take much of your time here on this topic, but as it relates to this discussion around literacy, we just wanted to bring some awareness to the committee of our current situation within the department. And as we look to really prioritize literacy, what that looks like long-term, just wanted to make sure that you're aware of the current situation. And so no particular ask as of today. We're still working on different options, what things could look like in terms of resourcing the statute in as minimal way of possible, but just again, wanted to bring it on the radar. So it was discussed a little bit earlier, some changes that have happened over time in regards to our statutes on literacy. Back in 2011, there was a statute change that really required districts to have improvement plans. And so it was really more of a compliance thing. Those were, filed within the department, those were tracked. But as Senator Rothfuss mentioned before lunch, the big change really came in 2019. And what we saw in that statute change that many of you were here for was really that my office be the entity that identifies screening instruments that are appropriate to be used by our districts. It required evidence-based interventions by the districts, reporting of progress, and again, more approved instruments. And that report really grew a little bit in terms of requirements from the districts. So at that time, there was no literacy individuals employed at the Department of Education, which is a bit interesting knowing how much we've prioritized that. There's a grant that comes through the federal government where those folks work exclusively for that federal grant. But really, in terms of collecting these reports, monitoring progress, identifying screening instruments, it's really gotten passed around the department over the years. And folks even that were working in federal funds where it probably wasn't appropriate to be. And so what kind of came to a head after that 2019 legislation in 2022, I think was, and this was before my time, but was a bit of a breaking point in terms of not having anyone to do the work of this reinvigorated statute. And so what occurred under Superintendent Balow was use of COVID dollars to fund a literacy supervisor. Those COVID dollars, of course, run out come September. That person has left the position, and so we're not going to be refilling that because those funds will be going away. And so that's also why when I came into office, we finally were able to get the screening and intervention rules promulgated. There really hasn't been anyone at the agency that has been able to take on that workload. And so again, no real ask today. We're working within our organization chart to find out where that could be repurposed and how we can kind of work around that if that does need to be a full-time position or where that could be absorbed. But really looking to you all to be thought partners in that. Of course, as I look at the organization before making a request for position, there's also little flexibility that I have over moving positions, moving people around because of the rules that we incur in state government. That's a little different than my background in private sector. So just wanted to let you know those challenges that we're facing in terms of who will manage that, what manpower we have at the state level. So with that, I will leave it at that. In November, maybe bring some recommendations if that means, helping us to identify changes in our organization chart or position. So with that, I would stand for any questions.
Questions for Madam Superintendent? Anybody? Go ahead, Chairman Scott.
Could we help your ability to manage your department by giving elected officials like you that have departments some flexibility beyond the state personnel rules so that you would have more say in who you hired and how you organize things internally?
Mr. Chairman,
Go ahead.
Mr. Co-Chair, I think absolutely. I've had this conversation with several legislators. The state of Idaho, it's very much that way for them. And so talking to some of my counterparts from other states, coming from the private sector, it's been quite eye-opening in that sense, that it is really inflexible for us to make changes and make efficiencies where needed. And this is one particular case. So I would say yes.
Further questions? Further comments?
Mr. Chairman, that's something I think maybe this committee ought to think about.
Yep. Agreed. All right. Thank you
Thank you,
very
Mr.
much for
Chairman.
updating us. Okay, so next on our agenda is public comment on the literacy. Anybody like to comment? Going once? Going twice? All right, we'll close public comment on the resourcing of literacy statutes and go to committee directives. Committee, do you have any directives on this section of the agenda? Go ahead, Representative Clauston.
Thank you, Mr. Chair. I would like to make a motion that we have LSO draft legislation on the Imagination Library on the 50-50 split that Representative Yin talked about.
It's been moved and seconded that we ask LSO to do a bill draft on, and the second is by Representative Provenza. Any discussion? Anybody? None? Okay. Senator Biteman, go ahead.
Well, since nobody else will say anything, I just would, ask, are we good with model legislation again? Because for a while there, it was out of style, and we were talking about Wyoming solutions to Wyoming problems. I just wanted to make sure that buzzword is gone and we're back to model legislation again.
Yes, I think, go ahead, Representative Clauston.
Hey, Mr. Chairman. Thank you, Senator Biteman. I completely agree. I think we need to look at what fits for Wyoming. It's a great program used throughout the country and throughout the world. It's a cheap way to educate these kids, and it saves us in some other areas. But I think, with our rural population, I think we need to have LSO look and see what works best for Wyoming.
Very good. Further questions? Comments on the bill draft? It's been moved and seconded. If there's no questions, we'll proceed to vote. All those in favor signify by saying aye. 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 Opposed? I'm sorry, Chairman Brown, were you good? Or, okay. So that motion's passed. You guys work with Representative Clauston to get all the ideas together. Thank you. Okay, any other committee directives? Before we move on. Okay, we're moving on. We're going to go to K-12 mental health. And then the first one up is update from the Mental Health and Vulnerable Task Force, which is Representative Larson and our State Superintendent Megan Degenfelder and Lachelle Brandt. And Fred. The floor is yours, Madam
Mr.
Superintendent.
Chairman, did we have a PowerPoint that was passed around to members of the committee? Great, perfect. All right, well, thank you, Mr. Chairman. I'll go ahead and kick us off from the perspective of K-12. This has very much been a thorough conversation between my agency and the task force, many hours, many meetings regarding this topic, and we've worked through a lot of different iterations and what this can look like. And so wanted to just, since I haven't been here to personally present with the committee on this topic, take us back to kind of where the evolution has occurred in relation to this topic. So of course, just always reminding ourselves of the purpose of what we're looking at here. Suicide rates in Wyoming outweighing the national average, very high percentages of Wyoming youth experiencing thoughts of suicide or major depressive episodes. I would say that this, while I was campaigning and meeting with every school district, this and the teacher shortage were the two largest issues that we heard from school districts. Also, as it relates to behavioral issues with students, it was one of the top 3 concerns that we saw from a statewide teacher survey, as well as the Teacher Retention and Recruitment Task Force. And so that brings us here, as well as then, when you couple that, increasing suicide rates in our state and with youth, and behavioral issues that we're seeing from teachers being able to get back to the basics and teach. We've also seen a breakdown of trust between parents and our schools as it relates to mental health, to intervening with students without parental consent or involvement. And so we're really at a critical position where not only are suicide rates going up, but trust from parents is going down. And so we need to have a systematic change in how we're addressing mental health in K-12 and what that means in terms of who's providing what and what the role of public education is. The only way for us to get back to the basics in education, which is my goal, is addressing these student needs through their parents. And so that brings us to discussion today. And so as we look at the topic of mental health, what are those principles that we bring to the discussion, or that I've prioritized particularly? And that has been parental rights. First and foremost, we have to have parents engaged every step of the way in this process. Second is specialization and efficiency. This is all about really specializing who should be providing what. Schools cannot and should not be everything to everyone. Teachers are not equipped to intervene in mental health crisis scenarios. And so how do we, again, make sure that all of these different positions, our mental health providers and our teachers, are specializing in what they do best? I, of course, come from an economics background, and so this strikes me especially from the get-go. And then thirdly, that intervention is best referred out. That really ties into number 2, that we should not be doing everything and treating kids in intervention at the school level. But how do we have a community system with parents, with outside community resources, where we can get students the help that they need with the voice of their family? So that has led us into developing this GRIT framework, which I believe at your last meeting, my staff expressed to you, and it's really about developing resiliency in our students. And so the GRIT framework has 3 key components: prevention, identification, and referral. You'll notice in there that it does not include intervention. I think what's really important in this system is that we are doing those steps and referring out for the intervention that involves with families. So as we look to prevention, what do those pieces mean? There are a few different items that we've identified that fit with prevention. The first, you'll hear a little bit more later on our initiatives with student-centered learning. I've always expressed that in mental health, I think that the more individual pathways and student-centered learning, I think there is a correlation to a student's well-being, their desire to be happy, to be in school, to be fulfilled. So that's one piece that is within our Future of Learning partnership that we'll discuss later today. The second is transparent teacher teams that identify strengths of students, but also obstacles, but refer out anything that's beyond their academic expertise. And so we'll go into, there's one particular entity that has gotten really good at this and has done it around the country, and talk about what that means. And that's really shifting from just single teacher siloed responses to children that might be having an issue. It brings together a team of teachers that can, if they notice a red flag, they can look at that, tier them into 3 levels. Tier 3 is referred out to a mental health provider. It's not dealt with the schools and within those walls. But tier 1 and 2, maybe just to check in, what does that mean? How do we relate that to their academics? Maybe they're busy with certain activities and so their homework isn't getting done. Can we do that different times of the day or change how we educate them? Third and fourth are really just our typical suicide prevention and MTSS structured trainings that we do at the WDE. It's really just helping for that structure, not with what's within MTSS, but then also just that generic suicide prevention training that many of us have gone through or know about. So that's prevention. Second, identification. So this brings in, all right, what that point when a student is in tier 3 with that teacher group, how do we transition them immediately from teachers to parents and community systems? And that's really what this system is meant to do. And then to create a communication channel to parents, have someone that serves as that conduit, because right now there's a really large gap between what's happening in the school and what's being communicated to parents. And so that brings in our AWARE program that you've also heard a lot about, which is really, like I said, that conduit between our mental health providers and our school system. And then lastly, it's all about referral. So that next step, how do we make sure that there is a conduit that can connect parents with both local resources, but sometimes local resources aren't what parents feel comfortable with. So how can we provide things like our care coordination that connects them with providers that might be virtual, might be in a different location, particularly in those in rural areas. So that brings kind of to this last slide here that is about aligned programs. And so it's those very programs that meet the framework that is GRIT, and that the Mental Health Task Force has taken a lot of time to really dive into, to talk to certain entities that are doing this across the state and to build what that would look like in Wyoming. Because to Senator Brightman's point, we're all about creating Wyoming solutions. And this is really what this is. It's not taking massive vendors that try to, involve themselves in mental health provision. This is about building a Wyoming GRIT framework. So again, the student-centered learning pilots, you'll hear about those later this afternoon. But really the three that are directly aligned here, the first is BAR that you all heard from at your last meeting, which is about prevention and identification. The BAR program will tell you they do not provide intervention in mental health. They are prevention and identification. That's really what's important. And they have those 3 tiers where teacher teams identify. Their teachers are, of course, they're the ones working day in and day out with students. They're with them all the time. They are our first point of contact when it comes to students. And I think that's what I like about the BAR system is that, number one, we don't have students in rogue situations or in silos making decisions. You have a group of teachers in a transparent manner talking about a concern, and then how do we refer them for the help that they need. And so you all heard from them at the last meeting. And then AWARE, which you also heard about, which we've developed pilots across the state through the department. And that's really having individuals that are that connection between the community system and the school. Because a lot of times teachers that I've spoken to, they don't know what to do. Who do I connect this child to? I don't want to overstep parents, but I don't know what to do here. And that's really what that system is meant to do. And then lastly, the care coordination, which I talked about, is really services where parents can call in, have different options for access for their children. If they're in a small town that they don't want stigma of their vehicle being parked outside of an office, they can connect with virtual options or those out of state, but that's what that is meant to do. And so with that, I would note we're in the process. The committee has spent, as I said, hours and hours going through what this can look like. Costing, of course, comes up. And what the chairs and I have discussed and I think agree upon is that I don't think it's ever a good idea to throw all our money in and scale immediately. When we don't know what the data is, we don't know what's going to work. And so what we've discussed is how can we look at piloting some of this across the state and have real data to be able to identify if this works. And that's the point where we're at with this. And so currently we don't have precise numbers for you today. We're trying to, the original number that we got was around 14 million. And we are trying to scale that back as much as possible, looking at efficiencies with other agencies, duplicative spending in these areas, and try to look at how do we make this cost effective. And so with that, I would pass on to the co-chairs to add any additional information.
Representative Larson, please go ahead.
Thank you, Mr. Chairman and members of the committee. It's really good to be here with you because it's interestingly enough, the Management Council kind of tasked this committee and the task force with the same responsibility of identifying how we implement mental health in the K-12 model. And so the Chairman Northrup and Chairman Baldwin and I have kept somewhat in touch with the conversations that you've had to this point and what we've had. For the committee's interest, I might just share with you that the task force is a little bit uniquely made up in, we had members of the House, members of the Senate, but then we had representatives from the Department of Education. Mr. Brown was on that task force, the Department of the Director for Department of Health, Director for the Department of Family Services, and a Director for the Department of Corrections. And as we've talked about mental health issues, this being one component on how to provide mental health services in the K-12 model, we've really appreciated the input from districts and individuals on the challenges that they have and the real life day-to-day challenges that come in when when you think of mental health challenges in the school. You oftentimes just think of somebody who has behavioral challenges come to school and you anticipate it, but you don't anticipate the straight A student who may have ideation or suicidal ideation, or that may be struggling from other things that are catching us off guard. And these are more of the things that we're trying to catch. Our task force is then to make recommendations to a standing committee on some of the other topics that for example, vulnerable adults and adolescents with high behavioral needs, where we're making referrals back to joint judiciary. We are, for the K-12 model, we would be working closely and making recommendations back to you that we now have ready. What the task force really was trying to decide to make a recommendation to you really is what is the role of the state in providing mental health services in the K-12 model. And what we did conclude is that we don't want to turn our school districts into mental health providers, that we've tasked them with enough, and we want to make sure that, and we think that that's the policy that we should adopt. And as Superintendent Degenfelder said, that we think that there's three things really that are policy issues that we think are needed that school districts should be doing, and that is the prevention component, and then to identify or to screen, and then to refer to services. We like the AWARE program. You know, the day that you heard about AWARE, we was in Kimmer and Bar, we was in Kimmer talking about the same thing. Then our follow-up conversation, we had Bar, and I think we were meeting almost at the same time. We like the AWARE program, and we feel that filling in the prevention training with something like Bar fits the intent of the policy that we would like to adopt and that we would like to recommend back to you. We would like to recommend that combination to be adopted statewide, but perhaps not. We need some data, as Superintendent Degenfelder alluded to, on how well the BAR program or similar program is working on the prevention side, and then maybe ease into that until, and if it proves to be beneficial, then I think funding it the legislature will have a greater appetite to fund it. As we looked at the AWARE program, some of the efficiencies we identified is in the pilot programs, they kind of had a little stash of cash for those who are uninsured or underinsured. But the nice thing about having the Department of Health there, they noted that with Medicaid and with the CHIPS program, that really should be available now, and that they shouldn't have to have. So that, just right off the top, that's a $500,000 savings on an annual basis. And so it was helpful to have them there to say, well, remember, we have this program, and now as we move AWARE out of the pilot range and into full implementation, there's probably some efficiencies that can be captured to reduce that initial cost. Superintendent Degenfelder said, if you were to take the model, the pilot program, and just take it as it is, it'd be about $14 million a year. We think that that's significantly less, but we're significant. What's that term? Under 10 probably, but we don't have those numbers clearly identified. And you'll recall last year we contemplated looking at just increasing counselors statewide, and if we'd done that on an annual basis, that was going to be 125 million a year. So we reduced down $110 million. The interesting thing that we look at as well, and I'm sure that this committee has dealt with the same challenges, is we'll refer, but the challenge we have in Wyoming still is the number of providers. And as we've met with school counselors, community mental health providers, and private providers, the consensus is that in total, there still isn't enough to meet the needs that we have. And so we're going to have to be wise in how we get services to our kids and not be restrictive to say that it can only be from one source or the other. I think we're going to be forced to get services from wherever we can and take advantage of technology and otherwise, but I think that'll be fleshed out a little more. I just, when it's easy to say, well, all we need are more counselors or more, social workers. Fine, but where are you going to get them? There's just, the demand is there. We would take them, getting them to come into the state is a challenge, and I think it's a challenge that we identified a number of years ago in labor and health, and it has not, the demand has not decreased, it's increased. So, Mr. Chairman, we like the direction and feel like that there's more clarity from the task force's perspective on what the policy should be to prevent, to identify and refer, and then to implement these programs, and would also reiterate what Superintendent Degenfelder said, that we would like to come back in November with some numbers, and if it's your desire, we could even start drafting some legislation or wait and allow you to do that, but would take a little direction from you on that matter.
Thank you, Representative Larson. I believe that if you guys start drafting some legislation, we can certainly amend anything that we don't like in it. So please feel free to give that a start and get a head start on that. And we will wait for your recommendations until November, because you guys are working this all the time and directly, and we appreciate your work. Thank you.
Thank you.
Representative Provenza.
Thank you, Mr. Chairman. And thank you, Superintendent and Representative Larson, for being here. I guess what I want to do is maybe share a concern that I have, which is, and Representative Larson, you touched on this, but this refer process sounds great in a place where the resources exist. And the reason why mental health is at this committee is because we know that those resources don't exist. I serve on judiciary. I've heard district court judges and people in their communities say we have to send kids to the Boys and Girls School to get mental health services that they don't get there. They were funneling kids to places that don't exist or that can't provide the care that they need to help achieve the results that we want to have for them, which is joy. If we aren't going to tackle some in-house mechanism for mental health, we're looking at a system that's overburdened, under-resourced, and that has wait lists for adults. And our suicide rate for adults is the number 1 or 2 in the country. So the refer component gives me a lot of heartburn. And I don't know, I guess maybe what I'm looking for is more guidance on how are we going to make these systems more robust so our teachers can refer. And what's the middle ground until we get there? Because I know we're not there.
Representative Provenza, in my opinion, really identifies the concern that we all have, in that what magic wand do you wave to make sure that the services are there? The same is in the battle or the conversation is as well, do we then put the resources in the school and have the resources there? Fine, where are you going to get them? You know, there's the absence of the human to provide the counseling. And so we've erred on the side of that, not trying to somehow capture it and put it in the districts, but have it somehow captured and have the districts be able to refer. Do we have all of those wrinkles ironed out? No, not even close. But we think that the structure is the most sound for the K-12 model and for policy as a whole. So then the conversation that has been in the task force with the Department of Health and others is then how, and it's not dissimilar for the same conversation we have with services for vulnerable adults, where you see that, you know, whether it be guardianships or just services for them for the same issue, is how do we get them in the state? And I wished I could just connect that dot for you, Representative Provenza, but I think we are further, we're at a better place than we were 2 years ago. But to tell you, this is how we're going to get these services here, I do not have that answer. And I share your concern. On a positive side, the provider that provided services in Fremont County #1 has indicated to us that they are in a position to where they could expand to multiple districts around the state. That pilot program helped them iron out a lot of the problems with it, but felt overall it was quite successful. They says, we only hope that you don't say we're going to implement it by October or November 2024, because they need time to ramp up to with the same concern, but they like the structure. And so I think also visiting with some of the community mental health providers, even with the behavioral health redesign, making this priority now a priority population helps, particularly on the referral part, but we still have a deficiency in manpower, right? And so then we say, but we can do tele, and that's wonderful to a point. It's not a cure-all. And so I think with your background and your expertise, we're open to further ideas and suggestions, but I think the framework is there. It's just how to, we've got the container, now how do we fill it? And I think that's fair, Mr. Chairman.
Go ahead, Superintendent.
Mr. Chairman, Representative, if I could, for me, of course, I've said before, fundamentally, I don't see services, treatment being in schools. But that aside, I hear your concerns of just having those shortages outside of schools. I think there's two components of this that help in some way. The care coordination, the virtual options provide more options out of state for families. But then I would also go back to our prevention and identification. So when you look deeply at this BAR system, it's not just about those egregious red flags that we're seeing. It truly is an upstream prevention of these teacher groups are getting together and saying, hey, well, Joe has really expressed an interest in welding. What is a pathway we can get him in the CTE field? That I think so much of that is missing, the student-centered learning that is helpful in prevention that far ahead, so that it doesn't become then a behavioral issue where they're acting out because they don't appreciate what they're doing, all of that. And so I do think that that's an important part of the BAR program. They're looking at strengths and concerns in that process. And so hopefully to try to prevent as much as possible.
Go ahead, Chairman Baldwin.
Well, thank you, Chairman Northrup. I just, not a lot to add to that, but I would add to this another perspective, and that is that we're looking at the upstream side of things. We talk about the downstream, as Representative Provenza talked about, what are we going to do with these tier 3 kids that we find that truly need some mental health assistance that needs to be outside of the schools? We've all agreed with that. And the task force was unanimous in that decision. We don't want to turn the schools into a mental health treatment program. That's not what we want. But by looking at the identification and prevention, maybe we're treating some of these things upstream so they don't become the downstream problems that we're going to have them. They're not going away, but maybe we can reduce that number. So as we're trying to develop this framework for the other things that we need to do, let's work on the upstream and keep some of these kids from jumping into the river to start with so we don't have to pull them out. And I think that's the important part of what we've talked about. And I think that the task force has been a unique group. We're all unique individuals. We have a lot of unique, but I think the single thing that we've all heard on this task force, there's a need to help our kids in this topic. And I think this is one way we can help. And maybe there's a framework down the road where we have all the people we need, the clinicians. We're not there. We're not there in physical health. We're not there in mental health, but we're on our way there. I would just add, thank you, Mr. Chairman.
Thank you. Chairman Scott, please go ahead.
I'm trying to understand the scope of the and nature of the problem. You know, a lot of the school-aged older kids are in the area where very serious mental illnesses like schizophrenia will often first manifest themselves, junior high, high school level, some of them later on, but it does include those groups. How much of the problem is those kind of kids? And then we have the problem of kids that are having difficulty with school. Frankly, some of our failures from the early literacy, unable to cope. They've been socially promoted and they're unable to cope with the work in the later grades because they can't read well enough, can't do math well enough. How much of the problem is those kind of kids? I think they're a good part of our discipline problem where those kids act out. Are they also showing in the mental health area as part of the problem?
Do any of you feel qualified to answer that? Go ahead. Representative Larson.
So Chairman Scott, with your background on Labor and Health Committee, you'll recall that on the behavioral health side, when we've had the support waiver and comprehensive waiver, and in the schools, we've got our, special education with IEPs, but then we have, and I think this is a little bit to what you're referring to, our system, our current system in the state for handling these kids with high behavioral needs, could be schizophrenia, could be some other things, where do we send them? And our system currently is we send them to a BOCES or an RTC, if warranted a PRTF, and they take them if they will. They're not required to. And so at any one time, we'll have up to 20 of these young people that have behaviors that are too difficult to place. And so then we're strapping our schools to find a place for them to go, or they end up, as we've seen around the state, spending time in a county jail or in the emergency room. And so that's one of the areas that the task force has been working on for the last 2 years. And it's a gap we've had in our state system. And we believe, and what we've recommended is that we need to be able to take, and there's around 20 at any one time around the state that are that acute, that we should be able to take them and keep them safe, keep them on their medication, and continue with their education until a more long-term placement can be provided to meet their needs. Now, that may be similar to, it may be that they just can get on medications and become stabilized, and then maybe one of the existing providers can take them. But until then, what do we do with them? And we think that the state has a role there that has not existed. But there's some of that we don't know. We put out an RFI to see if there were interested parties last year. There were 4 providers that come back and says, we do this, and what we've then elected to do, and we're using some of the leftover ARPA money, hopefully to do that with, as soon as we get that done, is to put into place a pilot program, and we can use, and we'll probably do it at the Life Resource Center, where we have those cottages that we moved people out of as we moved into the new campus. They're hardened, they're small, they can be used for, you can segregate the sexes, and to keep maybe, to start with 6 people for a couple of years to learn what we don't know on how to handle these people, and then make a more long-term policy recommendation for that. So although that's not a high volume in this overall population that you referred to, they're very high in taking time to address. And so we've been trying to address and come back with a recommendation, and feel that we've made enormous progress in that, and feel that we have at least the initial steps to address those.
Mr. Chairman,
Go ahead, Mr. Chairman.
what about the other half of the question? How much of the problem is caused by failures to be able to do the schoolwork because of failures in the earlier grades?
Mr. Chairman, Mr. Co-Chair, I think that's why we were so interested in this kind of upstream approach of an identification and the academic side of it, which is BAR. BAR is not the mental health side of it. It's really addressing some of those academic needs before it gets to that point. And for me, in speaking with teachers around the state, mental health, behavioral health, they're really equally concerning in that way, because behavioral health or behavioral issues in the classroom are not allowing teachers to be able to do their job effectively, to be able to teach other students. And so, I would say this BAR program especially can benefit every single child because it plays to strengths and obstacles in that way. So I think that's why we've tried to create this GRIT framework that does both of the things that Representative Larson mentioned, those really high need students, but also to help those before they start experiencing those behavioral issues even. Thank you.
More comment? Go ahead.
A different question. And Mr. Chairman, this may well be primarily for Senator Baldwin. When I left Committee 10, the Health Department was in the process of concentrating the community mental health centers on the very persistently, seriously mentally ill, and was getting rid of a good deal of the ability of the community health centers to deal with lesser mental health problems. What's happened in recent years have the community mental health centers become totally focused on that and lost their capacity to deal with lesser mental illnesses, which is what I think we're largely talking about in terms of numbers in the school setting?
Go ahead, Chairman Baldwin.
Thank you, Mr. Chairman. Chairman Scott, I believe, and somebody can correct me if not, I don't believe they've lost their ability to do that, but I think that what has happened, and it relates to what we've talked about, is that lack of clinicians, that lack of people, and the mental health centers the community mental health centers are experiencing that just like everybody else is. So if there's a lack of capacity, that's probably where the lack of capacity. Now, I would add to that, with the remodel or the revision of the behavioral health system, we're still new in that. It's August. It's only been in effect just a couple of months, and I think that's going to have an effect. But right now, I think the significant lack of clinicians is the biggest effect that we're having now. But I don't believe the community mental health centers, and I will use my own county as an example. I think that the county in and of itself has the resources, but I know that at the local mental health center, we're lucky to have one clinician on staff. And that's not a matter of we can't find somebody to recruit. There is nobody to recruit. And there's a lot of competition in that field. But I don't think that we've focused so much that we've taken away that capacity. Somebody may want to correct me on that, and others may have a better answer, but I believe that that's the case right now.
Chairman Larson, please go ahead.
Thank you. So, Senator Scott, I think what this really came down to was a policy adjustment to say for the use of state general funds, what's the state role in providing mental health services to the citizens of the state? And over the years, when you were chairing Labor and Health, that was an ongoing conversation. Are we getting the bang for the buck? So we had the, which the mental health component funding for mental health is one of the 4 or 5 most expensive things in the Department of Health. But they can also bill the individual. They can also bill Medicaid. They can also bill insurance companies, right? And so when we done the behavioral health redesign, what we in essence were saying was we reached out in the early conversation before we passed House Bill 38, 4 years ago, we asked the community mental health providers, in your world, who should be receiving services for these dollars? Well, it's the serious mentally ill, it's those diverting away from corrections, diverting away from the state hospital, and as well as a warm handoff on the way back, making sure that when they come back, they're staying on medication, that they've got a job, all of those things that we're familiar with. And we says, okay, and so then that's what we've done in the redesign. We said, for the state general fund dollars, we've created these priority populations that says that's where the funding goes based on, and they've got the reimbursement model for that. It is a significant change, but it does not take away their ability to continue to charge a fee for somebody walking through the door, or to bill insurance, or to bill Medicaid. But for the state general fund dollars, it will go to these priority populations with the intent to make sure, such as these that are in schools, that would be a priority population, can have access to what services are available. There is still a deficit of services, but it was a redesign in policy to say who should be getting mental health services for the general fund dollars.
Following up on that, there was earlier a testimony, I forget which one of you said it, that most of the kids involved here, school kids, are eligible either where they are low income, are eligible either for Medicaid or our child health insurance program. But we're seeing a shortage of providers. Are we defeating ourselves by being too cheap in our reimbursement of providers in the mental health area, such that insurance is doing them no good because they can't get any provider because they aren't paying enough to get a provider? Is that what's going on here?
Go ahead, Representative Larson.
Mr. Chairman, it's Chairman Scott, I don't think so. I think we've always been challenged with, are we reimbursing them adequately? But bear in mind, on the behavioral health redesign, we're not reimbursing the community mental health centers based on a Medicaid rate. That's a rate that's been worked out through the Department of Health and the community mental health providers. Now, in Project Aware, if somebody was to receive services, to say that they would, that reimbursement rate would be based on CHIP or Medicaid, I think that's accurate, but we've not made that, we've not implemented that yet. So I think that we don't have that data to support or deny that at this point. If you think we ought to raise that rate.
Mr. Chairman, I don't know whether we should or not, but I don't know enough. We ought to be able to get the services to these kids, but if those services are going to be reimbursed because they've got insurance through Medicaid and Child Health, and a lot of them will. If you don't reimburse enough, you don't get the services because you can't attract the providers because you can't pay them. And I'm wondering if that's part of the problem here.
Representative Parenza, you've had a hand up for a while.
Yeah, Mr. Chairman, thank you. I'm trying to go through the 2021 bill and find those definitions because would like to understand how specifically kids in these potentially acute situations, maybe they don't meet the definition of severe mental illness, are fitting within that. Because at the time, my concern was that if we prioritize justice involved and then DFS involved, which we should provide services to, then when we go back to your conversation about going upstream, are these kids specifically DFS involved, and is that how they're getting in? How are they finding funding?
Mr. Chairman.
Go ahead, Representative.
Thank you, Mr. Chairman. And thank you for that slow one over the plate. That's the reason we put children in there. We wanted to get them before adjudication. And so if a child or if a family was in crisis and was at risk of being separated, they fit into that. And in the original bill, DFS could make that recommendation. And then I believe either the next year or the following year, the Labor Committee brought a bill that then said that they could be referred also to the community mental health centers from the schools. And in that, when they were at risk. So we took away, that was the intent. We wanted to get to them before the family was adjudicated or was at that level of crisis, right?
Representative Clausen, you have a question?
Yeah, thank you, Mr. Chair. Kind of a comment and a question. To any of you, the BAR program is a highly successful program. I think most people maybe in this room don't really understand what it is and how well it works. So is the plan that we would roll out BAR to pilot schools in the state? They're student focused, they're not score focused or grade focused, they're student focused on the person actually. So is that the plan now? We'd have pilot programs in certain schools in the state, and when would that start?
Go ahead, Superintendent.
Mr. Chairman, Representative, so we've already begun with a few pilots in the state with remaining ESSER dollars. I believe some are even here today that might be willing to share that experience. The plan here would be that we continue to build that pilot, but as we mentioned, not scale until we can see some data. Talking to other states that have implemented this model, data has been academic as well. They've seen positive attendance rates, test scores. I think we would plan to collect data on all of those different metrics. To see what's working in that sense. And so that would be the plan. Also that it would be opt-in, not forced on districts. We've discussed different levels of performing schools, maybe our schools that are not meeting expectations as a form of our state system of support, but then some just that are interested. So that's kind of what we're hoping to bring that kind of cost structure down to you in November and what that looks like.
All right. Go ahead, Representative Provenza.
Just a quick comment. No one needs to respond to this, but it sounds like maybe some of the behavioral issues that we see across children would maybe benefit from something like a school before a school, like maybe a preschool.
Okay, thank you very much for your presentation. We'll look forward to hearing from you in November. So now we are up to Medicaid billing for school-based services, which is 25 LSO-0095. Well, we could. I thought about it, but it says it's all at the bottom. Do you want to do public comment on what we just heard? Let's do this. That's what I am too. Then we'll take it all at once. So Tanya Hytrek and Math Wilmarth, welcome and thank you for presenting.
Yes, Mr. Chairman, members of the committee, we're back on agenda item number 6, 25 LSO 0095, committee formal draft. 1.0 Medicaid billing for school-based services. Recall at your June meeting, the committee directed LSO to draft a bill to require school districts with more than 2,500 students bill the Department of the Department of Health for Medicaid-eligible special education services. I would note, currently, under this law, it's permissive for school districts to bill. You heard testimony at your last meeting that there were only a limited number of school districts actually doing this. I think it was actually one. And so as a result, this bill draft was requested. On page 1, line 12 through page 4, line 2, that contains amendments to Wyoming Statute 2113, 321, which governs the special education payments to school districts. As I said, currently the law provides billing for such services is permissive pursuant to subsection H, this section, and amendments contained on page 2, lines 4 through 6, and on lines 12 through 20 operationalize the committee's directive that those school districts with more than 2,500 students are required to bill the Department of Health for those services effective July 1st in each school year thereafter. Moving on to page 3, line 10, through line 14, this is an obsolete provision. It applied to school year 21-22. It's a conforming amendment just required as a result of amending this particular subsection of statute. The language inserted on page 3, lines 19 and 20 is a conforming amendment to clarify the measurement of those students, how those students will be measured in determining the 2,500 student threshold. And then finally, page 4, line 4 contains section 2, which states that the effective date of this act is July 1st of 2025. And at this point, I would turn the presentation over to Matt Wilmarth to discuss his memo related to this bill draft.
Go ahead, Matt.
Thank you, Mr. Chairman. Members of the committee, Matt Wilmarth, LSO, Senior School Finance Analyst. Also at the June meeting, in addition to the bill draft, you requested 2 items of LSO. The first, within my memo, relates to the pilot school districts. If you recall, the Wyoming Department of Health worked with 5 school districts to pilot this billing process with Medicaid. They got agreements with the 5 school districts. Tanya indicated only one ended up participating last school year. That was Converse County School District number 1. I reached out to the 4 other school districts that were going to pilot it and sought their feedback at your request on why they chose not to participate. 3 of the 4 responded, and of the 3 that did respond, Crook County School District number 1 indicates it anticipates participating in school year 2024-25. I will say from a policy standpoint, this was implemented as a way to share costs across the state and federal funds for special education. Just last year, school year 2023-24, state special education reimbursements are going to increase approximately $19 million. That's about a 7.7% increase. The estimated annual savings, if all school districts were to participate from the government efficiency report that implemented this work, was approximately $3 to $6 million annually. So this past year's increase of 19 million could have been perhaps 13 to 16 million. In terms of this bill draft specifically, on page 2 of the memo, you can see the cumulative percentage and the school districts in terms of who meets that 2,500 student enrollment count. This is based upon the October snapshot period referenced in subsection J. It would capture 9 school districts under last year's October enrollment snapshot and encompass 61% of the total enrollment. Again, as Ms. Heitrek indicated, under current law, it's permissive. So this bill draft would make those over the 2,500 threshold required to participate, and the remaining school districts could still participate, which is not a requirement. With that, Mr. Chairman, happy to answer any questions.
Thank you, Mr. Wilmarth. Any questions for either of them? Go ahead, Representative Clauston.
Thank you, Mr. Chairman. I guess the question I want to have answered is why aren't other school districts doing this? I mean, is it an administrative burden? What are you hearing from our districts?
Mr. Chairman, Representative, I think if you hearken back to the June meeting, that's exactly what school districts reported, is that there is a certain administrative burden in billing the Department of Health for these costs, but I would certainly let the school district speak to that. That's my recollection of that discussion. And one side note that I was remiss in mentioning is the Department of Health does have some minor amendments or suggestions to this bill draft. They are not incorporated in this draft, and we'll let them to speak to those.
Mr. Chairman, in terms of the administrative costs, we'll let the school districts provide their reasoning as to why they have chosen not to participate. But I would remind the committee, there is a provision within the special education reimbursement that allows school districts to be reimbursed for that administrative cost at a reasonable amount. So if they do have administrative costs, they are 100% reimbursed.
Further questions? Go ahead. Senator Beitman.
Thank you, Mr. Chairman. Is there a fiscal note for this bill yet? I didn't see it in my notes.
Mr. Chairman, Senator Beitman, no. We would, like any legislation, we would work with, if the committee chooses to sponsor it, we would work through the fiscal note process to identify a potential fiscal impact in terms of both administrative costs with either the Department of Education, Department of Health, and then any potential cost savings through these school districts that would be required to participate.
Okay. Do you have a ballpark idea what we're looking at with this bill draft in its current form?
Mr. Chairman, Senator Beitman, I do not. I would defer that to the Departments of Health and Education.
Go ahead, Chairman Scott.
Mr. Chairman, I do not like these things. Mr. Chairman, my recollection is that 49 of the states get significant reimbursement for their special ed costs from the Medicaid program. And we're 50-50 shares with the federal government on Medicaid. And we're the one that does not. And the bureaucratic administrative requirements for dealing with Medicaid are expensive and bad universally across the country, but the other states have found it worthwhile to do that. So it seems to me fairly straightforward that what's going on is that since the bureaucratic requirements are significant, they take up not only the administrator's time, but the provider's time on a fair scale. They're choosing to just go with you get 100% reimbursement from the state without having to do nearly as much documentation and work. So they're just saying, it's the easy way to do it, we're going to do it that way. Is that a correct analysis of what's going on here? And if we pass this bill, will the districts just ignore it?
Go ahead.
Mr. Chairman, Chairman Scott, we can't speak to whether that's why school districts are not, billing Medicaid in this particular state. What I would say and remind the committee of is, unlike most other states, two things. One, you have 40 years of school finance litigation dictating what your educational responsibilities are, which include a fundamental right to public education, which is different than a lot of states. And then secondly, special education is 100% reimbursed. And so in other states, there is perhaps more of an incentive to work with the federal government to obtain these reimbursements. In Wyoming, where they can submit it and under current law be reimbursed for those costs. And to your point about will school districts ignore it, I guess you would hope not. That's why you pass laws, is that they would hopefully comply with them. One mechanism that you could use as enforcement is have it as a condition of receipt of any special education reimbursement for those school districts. I think we did briefly discuss that at the June meeting, but that was not the directive of the committee.
So I have one question I was just sitting here pondering was, tell me about maintenance of effort and how this would affect that.
So, Mr. Chairman, you have two items. Maintenance of financial support is at the state level. So the $280 million that will be reimbursed this school year. That is the state requirement to be made available to school districts across the next fiscal year. That's maintenance of financial support. Maintenance of effort is a local education agency requirement where they have to expend the same amount of money at the local level. But there are exceptions to reduce your maintenance of effort. And I would, again, defer to the Department of Education for those reasons. I understand some of them could be, you have a lower population that you serve from the prior year, you have retirements, so your labor costs could potentially be lower. But the maintenance of effort is local education agency, maintenance of financial support is a state responsibility. In terms of this bill draft impacting that, it doesn't necessarily impact it at all. You still, under IDA, have to make available the same $280 million next year. So what this does is ensures that the $280 million that potentially gets reimbursed the following school year doesn't increase the 7.7% it is this year. Perhaps it's only 7%, or not 19 million, but maybe 13 to 16 million.
Got it. Thank you. Further questions from the committee? Representative Lawley.
Thank you, Mr. Chairman. Thank you guys so much. I was just wondering, again, a little bit a different path, which is, are there any districts that are under the 2,500 student number that have what I would call an unusually high amount or of reimbursable type costs that would not be captured by the number of students, but by the services that they're required to provide by the student population they have? Has anybody looked at that? If whether there's not some that we're missing that by going just by a student number?
Go ahead, Matt.
Mr. Chairman and Representative Lawley, I would again defer to the Department of Education. They're required to file a report annually on special education expenditures. And so they have a better grasp on certain school districts or reasonings as to why a school district may be higher. I know certain situations can be expensive, an out-of-district placement, for example. So it depends on the student and the reasoning behind that.
But those, excuse me, follow up,
Go ahead, follow up.
Mr. Chairman, but those numbers are available through the department to kind of get a feel for if there's some that are somewhat less than the 250 student number that have these unusually high amounts.
Mr. Chairman and
Matt.
Representative Lawley, the 2,500 student threshold was just a placeholder for this committee's discussion. I don't know that the Department of Education looks at that in terms of costs. We can certainly send that report and do our own analyses on that, but the 2,500 student threshold was just a placeholder for the committee to work from.
Yeah, thank you. I understood that. I just was wondering about if we might be missing something there, but thank you.
Go ahead, Chairman Scott.
Mr. Chairman, whether or not currently there are such students, you can predict from time to time there will be, because the very high-cost students come from very severe mental health or physical health, and those are randomly distributed across the population as a whole. So sooner or later, you're going to get one that's very expensive and in a small district. So you can expect that that will periodically happen.
Further questions or comments for LSO staff? Thank you, guys. Can we get Sarah Rogers and somebody from WDE to come up and answer a couple of the questions that were kicked out? Hi.
Mr. Chairman, Lee Grossman, State Medicaid Agent with the Wyoming Department of Health. To my right, I'm joined by Sarah Rogers, Provider and Benefits Administrator with Wyoming Medicaid, as well as Justin Browning, who's the School-Based Services Program Manager. We'd like to speak briefly about and review the following slides that y'all are getting right now with some recommendations on this bill draft. But just before I kick it over to Ms. Rogers, if we can go to the second slide here, the information that we're going to provide here in a concise way is really just focused on how we maximize federal dollars, which again is really the intent of school-based services. Earlier heard the question about potential fiscal note. Obviously, that's some information that we would need to conduct some further analysis on to get an updated number. But that being said, we do have a study that at this point is a bit dated, is from 2019, that projected as much as 10 to 14 million in savings with state general fund. So that would be, again, federal fund coming in to replace that amount. But again, obviously, we'll want to go through the fiscal note process to confirm that amount, but I hope that gives you a ballpark of at least what we would anticipate here. With that, I'll go ahead and turn it over to my colleague, Ms. Rogers, to talk a little bit more about this.
Welcome, Ms. Rogers.
Thank you. Good afternoon. Sarah Rogers, Benefits Management Administrator for Division of Healthcare Financing. I'm just going to go over a few introductory slides here to introduce this topic, and then I will turn it over to Mr. Browning to go through our suggested changes on the bill. As Mr. Grossman just reiterated, the primary purpose of this program is to maximize those federal dollars. The schools are already providing the services. So that's really, again, why we want to do that. On the next. So in addition to making school-based services mandatory for those larger districts, the school-based services can be further maximized along two dimensions. One of those is the eligibility group. So those children that are eligible for those services, we would like to broaden those services to the CHIP population as well as to the Medicaid population. And then we're also looking at the covered services. So additional services covered under an IEP or IFSP, and then also the free care services, which we'll talk about both of those here in the next few slides. So CHIP is our Children's Insurance Program services, and those mirror those services that are provided by Medicaid. The eligibility guidelines for CHIP are 155% of the federal poverty level to 200% for ages 0 to 5, and then 134% to 200% for ages 6 to 18. If we were to expand those, utilization would not increase since the services are already being rendered anyway, and there is a potential for approximately 10% increase in the school-based services participation, and thus federal reimbursement. So that is an estimate based on the number of children who are on the CHIP program who have an IEP or IFSP. The IEP and IFSP services, so CMS has updated guidance that allows school-based services to include transportation and personal care services. Those services still do need to be authorized in the student's IEP or IFSP. And this is already a common practice in neighboring states such as Colorado. And by including these services, the covered providers can be extended to transportation aides, qualified bus aides, and qualified personal care aides. So we would actually be able to enroll those provider types as Medicaid providers. And then the free care services, so those are services that are provided to the entire student population, and they do not have to have an IEP or IFSP, and those have been approved by CMS. Some examples of those services are school nurse and immunization services, behavioral health services, screenings and assessments for vision, hearing, and scoliosis, and Section 504 plans. And as with the other school-based services, they're already being provided, so that again would just simply facilitate federal match. And now I'm going to hand it over to Mr. Browning to go over our recommended bill changes.
Good afternoon, committee. As Ms. Rogers stated, a couple of our recommendations to be more inclusive for the school-based services program would be within the bill, if we eliminate where it says special education services or program and services and insert Medicaid eligible services, this would broaden services for which we can gain federal match. It'll allow program to align with services allowable by CMS without needing statutory changes in the future. And again, this will not impact current utilization. It only increases the amount of federal match available. It would require changes to statutes 21-13, 321H and J, and then 42 for 103A 36. And then to include CHIP, we would, after where it says Medicaid eligible services, we would insert Medicaid and CHIP eligible services, or eligible students. Eligibility for SBS can increase approximately by 10%, and there would be no changes in utilization, only increase in federal match available. And with that, we are open for any questions or comments from the committee.
Go ahead, Representative Clausen.
Thank you, Mr. Chairman. I just want to be clear, these are all school-based services. We're not pulling students out of a private area of medical care and putting them into the school system.
Go ahead, Justin.
That is absolutely correct. Sorry, Mr. Chairman, Representative Clausen. This would be just for those services being provided within the school system.
Further questions? Go ahead, Representative Obermueller.
Thank you, Mr. Chairman. Have any of the three of you, all of you, or some of you walked through the paperwork to be sent in to the federal government to see how onerous that process is or what it really takes above and beyond the reporting that they're already doing to the state?
Mr. Chairman, Representative Obermueller, just so we can advise appropriately, can you please clarify if you're talking about the paperwork that, let's say, a district at their levels having to complete in order to bill the Department of Health, or do you mean on the state administrative side to get any additional approvals to access these federal funds?
Mr. Chairman, no, I'm talking about the burden on the school districts themselves. If you have or know of anybody who's actually walked through that process and said this is terribly onerous, or it's just a little bit of additional information, or so we get a sense of what kind of burden we're placing on school districts.
Mr. Chairman.
Go ahead, please.
Mr. Chairman, Representative Obermueller, before I kick it over to my colleagues, I'll just say that it's important to keep in mind that, the three of us here live and breathe in Medicaid all day, every day, healthcare billing systems, and we want to recognize that that is not the day-to-day of school district administrative functions, right? So just please keep in mind that sort of relative piece in terms of we understand that that's a bit of a new world and a new function, but rest assured that we're obviously here to support that. And Mr. Browning or Ms. Rogers, sorry to jump in front of you there.
Mr. Chairman, Representative Obermueller, are you asking about the administrative burden that is falling onto the school districts?
Go ahead.
Yes, I am. I assume there's paperwork to fill out to apply for this support from the federal government. And my question was, have you or anyone you know of walked through that paperwork process just to see how onerous it actually is?
Mr. Chairman, Representative Obermueller, I did sit on quite a bit of the meetings with school districts as they were enrolling their providers into our system and obtaining their NPIs and becoming Medicaid providers. I've also sat through various trainings with the school districts as they're learning how to submit bills and learning how to document for the Medicaid piece. And in the beginning, it is a learning curve for some of these providers, but as they become accustomed to billing Medicaid, it can become second nature.
Go ahead, Representative Forenza first.
Thank you, Mr. Chairman. Thank you for your testimony today and for these recommended changes. Maybe what I'm asking you isn't fair, but I do want to know, and I think we talked about this before, and I apologize for my lack of memory from the last committee meeting. I think it's been 10 years since we met last, so it feels like it anyway. Is there a reason why we shouldn't centralize someone in your office? I guess there's the conflict, right, of you are Medicaid services, but can we take some of the onerous work from the school districts and pay for, is it 1 FTE or 2 within your office to assist our school districts so that we can maximize these dollars and hopefully they pay for themselves? Does that make sense at all?
Does anybody want to tackle that?
Anyone in the room?
Mr. Chairman, Representative Provenza, I would say the standard across most states is there's a full-time position within the Department of Education and one in the department, in their Medicaid office, and it's a collaboration between both departments.
Follow up?
Just to clarify then, in other areas, in other states, they're not essentially putting the burden on the school districts as much as they're assisting them through the 2 state departments.
Let's go ahead, Justin. Go ahead, Mr. Browning.
Mr. Chairman, Representative Provenza, the labor is still on to the school districts. The state departments act as support for the districts and provide that guidance. One of the options many rural districts in particular have is they hire what they call a Medicaid coordinator, and they work with the various districts and ensuring there's proper enrollment, that they're documenting appropriately, and that claims are being submitted appropriately.
Great. Go ahead, Chairman Scott.
Mr. Chairman, and my information is now 20 years old. My late wife used to fill out exactly this Medicaid paperwork for a child development center on exactly these issues. And it was a major burden in those days. The documentation that was required of the professional provider, physical therapist in her case, but it was a major burden and diverted scarce resources from treating kids to filling out the paperwork. My question for you is, in the past 20 years, has that sort of thing been adequately mechanized, computerized to remove that burden, or is it still an individual documentation thing you just can't get away from if you take Medicaid?
I will try to tackle that one, Mr. Chairman. I would say in the last 20 years, absolutely, that things have improved. I'll start with our provider enrollment process. It's done within a matter of hours, possibly, if everything is completed correctly, everything electronic. Our billing is all electronic. There are some documentation requirements, obviously. I will just say that we have great vendors. We have our enrollment vendor, our billing agent, or our, sorry, fiscal agent. We have program integrity, the staff at the state, that is all very hands-on and one-on-one with our providers to assist them with their billing. So not as much paper. We try to do everything we can not to make that happen. So I think it has greatly, I've been around for 20 plus years in Medicaid, and I would say it has greatly improved.
Great. Go ahead, Chairman Scott.
Great. Question on your slide number 6. What's a Section 504 plan?
Mr. Chairman, Mr. Co-Chairman, this question I think would be best answered by our colleagues at the Department of Education, but from my understanding, generally Section 504 plans are for those students who don't necessarily qualify for an IEP or IFSP, but they tend to be more behavioral based. But I can look into this more, and we can get back to the committee on what exactly the qualifications for the Section 504 plan and what services those provide.
Okay, we also have WDE in the building, so we can certainly ask. Anybody else, any more questions for these people? Senator Brightman, please go ahead.
Thank you, Mr. Chairman. Back to your recommendation to remove special education and replace with Medicaid eligible services. Do we have a list of these Medicaid eligible services that would be provided so we could determine if that's something we want to do? Or are we just going to leap without looking here?
Mr. Chairman.
Go ahead, please.
Senator Beitman, we do not have that fairly lengthy list right here, but we're happy to follow up with that list. That's certainly public information we'd be happy to provide. Unless, I don't think it's likely, but I'll look to my colleagues, see if they happen to have those memorized.
Mr. Chairman, Senator Beitman, no. I don't have them memorized, and it's a very lengthy list, but we can absolutely provide. We have a lot of reference materials back in the office that we can provide.
Okay, because Mr. Chairman, while you were talking, I've been listening in one ear and trying to frantically look through the Medicaid website to find it, and I can't find it. So obviously, we can't really make an informed vote on it without knowing what the list is. So I'll just leave it at that. Thank you. Oh, one more question, if
Go
I
ahead.
may. Regarding this move we're contemplating, would there be any additional federal requirements, AKA strings attached, if we did this? Or would things be under the current framework that we are in now? Does that make sense?
Mr. Chairman, Senator Beitman, no, the status quo will remain the same. The school-based services program does not dictate what services are being provided within the district. It is simply an opportunity for the state to get that federal match for these services, which we are already providing and which we're paying for 100%. The changes we would see would just fall under the documentation piece. Services, of course, would need to be medically necessary, and that would need to be documented in the case notes, as well as the data service and having the student's Medicaid ID number. Otherwise, when it comes to documentation, based off the new guidelines presented by CMS, those required for school-based services almost are nearly identical to those requirements under IDEA.
Okay. Representative Clausen, please go ahead.
Thank you, Mr. Chairman. I think something we would all find beneficial is kind of a cost analysis. Are we going to get $20 million more to the state? And then what are we going to spend on labor cost and software cost and billing and increased staff? So I think if this makes positive sense, I think we need to look at that. But if it's a minimal amount of money and we're going to burden our school districts more, then I think we stay at the status quo. I guess I don't really have a question, but is that something you can provide for us?
Mr. Chairman.
Go ahead, sir.
If I may, Representative Clouston. So again, just ballpark here from a 2019 study before implementing school-based services was looking at about $10 to $14 million of essentially savings to the school foundation account. Again, that's something we would need to analyze further in terms of seeing what exactly would be in a draft bill in terms of getting a fiscal note. But you're right, the administrative pieces, we've talked about that here and hear the questions on that piece in particular. There's several different ways to get at that in terms of the idea you heard from Mr. Browning. If districts can try to consolidate some of those administrative functions in terms of how they bill, but that's something we're certainly prepared and able to provide technical assistance on today. But it's certainly a new function, right? There's no way to gloss over that. And I think that is a policy decision in terms of, is that additional administrative work offset by the projected savings to the school foundation account? And certainly wish we had more specific or better answers in terms of it would take a district X number of additional administrative hours, but want to obviously be respectful of some of the unknowns with that additional administrative workload.
Go ahead, Chairman Scott, follow up to the question.
Yeah, the 10 to 14 million figure, that, I thought that was net of the administrative costs. It's not, it's just the amount that we would get additional, not regarding the cost of what it takes to get it. Is that right?
Go ahead, sir.
Mr. Chairman, Senator Scott, that the way that we would have provided that projection would be looking at really just services rendered where we can gain that federal match. So that's something we would have to, again, I think dust some of that off and take another look in terms of how some of the administrative components would factor into that.
Second, Mr. Chairman, does that include the changes that you all are recommending here, or is that the bill as it stands right now?
Mr. Chairman, if I may, Senator Scott, so this, again, with the additional changes here, we're really looking at opportunities, again, as we stated initially, to maximize those federal dollars. So would need to do some further analysis in terms of, for example, what that additional CHIP population could bring in. But it's safe to say that we would estimate that to be a more significant amount when we're adding those additional kids.
Representative Lawley, please go ahead.
I had a question concerning the moving to Medicaid eligible services. And then the statutes you mentioned under here about requiring changes kind of have to do with special education in the block grant. So it seems like we're going to need to actually create another statutory provision somehow, because I don't think by simply changing that wording that it would fit the purpose of 21-13-33-21. So that's just something to look at more closely of whether or not we could do what you're trying to do by just simply replacing in this draft. Does that make sense? And even what you said, what might require other changes, we actually might not have a provision that fits this expansion beyond special ed. Does that make sense? I hope it did. I told you more than I knew.
Ms. Heitrek has an answer for us.
But anyway, I just think that's something that we need to consider if we're going to consider moving forward. But
Go ahead, Tanya.
Yeah, Mr. Chairman, Representative Lawley is 100% correct. This is the component within the Education Resource Block Grant model that governs the special education reimbursement. And so currently, it's appropriate to have this provision related to Medicaid for reimbursable special education services. In the event you expand it beyond that, it would require a new statutory section. It's, just a different bill draft, but it is something for the committee to consider. It would look a lot different at the next committee meeting, and I wouldn't want the committee to be surprised by that.
Mr. Chairman.
Go ahead, Chairman Scott.
Following up on that, if we do it as an interim committee, it's just another bill draft. But if we were to pass this bill draft onto the session, then you'd have a alteration constitutional issue, would you not, as to whether we could expand it at that point?
Mr. Chairman, Chairman Scott, certainly that would be a consideration. Would it be beyond the original title? I don't know that the public would know you were expanding it to all Medicaid programs, specifically when 2113-321 is within the statute. It's a policy decision for the membership, but I did want to advise you of the differences in the bill drafting.
Okay. Representative Obermiller, please go ahead.
Thank you, Mr. Chairman. So it has been alluded to about the 2019 study. That was the efficiency study that we paid a lot of money to get. And within that study, this issue came up on how much money we would. So I'm wondering if we could ask LSO to possibly distribute to the committee members a copy of that report again, because within that is the gross number and the estimated cost and all of that efficiency study provided, and maybe that would help us.
Probably be a good idea. Go ahead, Mr. Chairman.
Just the section on this piece.
Yeah, just a section on this piece, right?
Yeah, right. Yeah, thank you.
We'll trim it down a little bit. Chairman Brown, you haven't said a word.
Mr. Chairman, I was just about ready to hop on and say the exact same thing is we don't need the whole report, just the portion on this. And I guess I appreciate being called on here because I do have a few thoughts on this particular topic. Sitting on this committee for 8 years straight, we've heard this discussion 7 out of the 8 years that I've sat on this committee. And I think what Mr. Grossman and Mr. Browning are laying out to us is you're going to have to expand this if you want it to be, if you want the juice to be worth the squeeze. And, you know, if we're going to do this, I can tell you just being married to a school nurse, the amount of work that is already being put on top of them right now with the parental rights and education bill that we passed last year, it has created an administrative, I don't want to call it a burden, but it creates much more documentation than they were used to. A lot of phone calls, a lot of emails to parents, stuff like that. And I think adding one more piece to the plate of the school nurses, which is where the majority of this information is going to be taking place, and or in the special ed area, does become a little bit of a concern to me. And that is what we've heard continuously over the past 7 years, is that there's so much extra work to do this that the few extra dollars it will ultimately make back is probably not worth it. But at the end of the day, I think, you know, expanding it the way that Mr. Grossman and Mr. Browning have explained, I think is not a bad idea to at least start the process. But it's still going to be a little bit of a hurdle for a lot of our schools to handle this, especially the low population schools.
Right, thank you. Anybody else have any comments? Okay,
Mr. Chairman.
go ahead. I hear, but I don't see. There you
Mr.
are.
Chairman, Representative Berger here.
The floor is yours, Representative Berger.
Thank you, Mr. Chairman, and I'm going to have to echo what Representative Brown said, but also add to, I guess I'm kind of confused. Sounds like the Wyoming way shouldn't be about treatment, you know? And why should we even be thinking about billing Medicaid? Especially speech language therapists that are in schools, that they're treating kids. Speech language therapists, school nurses are treating kids. If you look at me being a special ed teacher, I'm helping with extensive work and treatments on behavior programs through my training. I'm thinking, oh, maybe we shouldn't be doing that. If the Wyoming way is not to treat, then why should we even have the discussion on billing Medicaid? And let's go away from those treatment and those extra burdens that we have in school, because we would be able to save a lot of money if we didn't have those have to provide those services. So something to think about.
Okay, no question in there. Senator Whitman, you had? Okay. All right, if we have no more further questions for the Department of, oh, I forgot, I'm sorry. Health. Healthcare financing, there we go. Can we get WDE up to answer 1 or 2 questions? And Representative Lawley, yours is one of them.
Mr. Chairman, Megan Degenfelder again. Don't have exact information on things. We have not costed out a fiscal note on this yet. When you look at all districts, you're looking, and this is a big span, 3 to 6 million. So maybe ballpark, very much ballpark, 2 to 4 million in revenue. If that helps at all. Again, if the bill goes through, we would do that analysis. The 401, we do not have student level data, but we do have the total amount. And so we can provide that, so you can kind of insinuate based on, size of district and that sort of thing. I know we're validating the 23-24 data right now, but what we can sure get that to the committee just as soon as we can. And then I'll let Chief Hamill answer about the 504.
Good.
All right. Chairman Northrup, I don't know who asked the question about the 504.
I don't remember either.
Okay. Okay. Senator Scott, the similarities between an IEP and a 504, that they're both protections under the Americans with Disabilities Act. The difference between a 504 and an IEP under IDA is that while both of them require an individual that has a disability or a life impeding event or condition, to have an IEP, you have to have that. You have to be identified with a disability, and you have to have a need for specially designed instruction. So a 504 looks often very similar to an IEP, but it doesn't, because it will provide some accommodations, but it does not provide for specially designed instruction. An IEP provides for specially designed instruction and related services and those accommodations that an individual might need. Typically, a 504 can last through an individual's life, and we see those accommodations happening in workplaces. An IEP ends at 21.
I understand. Thank you. That was it. That was the couple questions I had. Anybody else have any questions for WDE? Great, thank you. All right.
Oh, yes, Mr. Chairman, I did have one question.
Please proceed.
You said 2 to 3 million. I was unclear what that was referring to.
Mr. Chairman,
Go ahead.
Mr. Co-Chair, in terms of fiscal impact that been asked by this bill. So for the revenue that we would receive, that doesn't include, a cost that a district may say that it costs to facilitate this, but at least revenue the state is probably looking, this very rough estimate, in that range.
Mr.
Please
Chairman,
continue.
they said 10 to 14 million to the general fund from the additional Medicaid reimbursement. You're saying it's only 2 or 3 million? Or you're saying that's what it would cost to get that 10 to 14 million? I'm still confused.
Mr. Chairman, Mr. Co-Chair, let me make sure we're talking about the same thing, that from our fiscal team, that is the amount of revenue they were projecting. So I'm not sure about the 10 to 14.
Go ahead, Matt. I think.
Yeah, Mr. Chairman, I don't know if the 2 to 3 million is only for the 2,500 or greater enrollments, and if the 10 to 14 is for all school districts. We can certainly work with both agencies to identify what those amounts equate to.
Okay. Okay, anybody else got any questions? Thank you for coming back up. We're going to open up public comment.
I think we need to amend this and carry it forward because what the net gain is not clear.
Yeah, we need to have know what the financial picture is before we do anything.
Yeah, before we take it to final.
Welcome.
Mr. Chairman, Brian Farmer, Wyoming School Boards Association.
Boyd Brown, Wyoming Association of School Administrators.
Mr. Chairman, just wanted to explain a little bit about why school districts have not engaged. Certainly, I think you can hear a little bit from the Appendix A in the LSO survey about this burden or the challenge of meeting Medicaid requirements. But here's just sort of some of the reasons. First of all, Medicaid's complex. It's not school district business to do it. It's not like if we owned a physical therapy clinic or a medical clinic and that's our proficiency. So the actual complexity and subject to frequent changes that make it difficult for districts to stay compliant. Also, there is the challenge of eligibility verification. So determining what students qualify for Medicaid can be both time-consuming and require accurate documentation. So you just saw from Department of Health, the eligibility requirements are between 155% of federal poverty level and 200% of federal poverty level. We don't know what ones of our kids meet those marks. The only mark that we know is the school free and reduced lunch, which is 185% of the federal poverty level. So we kind of split the difference there, and we know that perspective, but we also only know those that report that. We don't know how many of those families that are eligible that don't report that could potentially be eligible. And I take it from the way that this is worded that our obligation is to determine when we are providing the services whether or not the student is Medicaid eligible or not, and then bill accordingly. So obviously there's a burden to staff, there is a lack of expertise, but there's also accurate coding that's required. Ensuring that services are coded correctly according to Medicaid guidelines is crucial for accurate billing and reimbursement. So that's a piece of it, is again, the expertise of the Medicaid, the billing. It also requires sufficient documentation to support claims, which can be time consuming and require additional training. There are some other reasons that include HIPAA compliance, data breaches. With risk of data breaches growing, schools have to implement robust security measures to safeguard sensitive information. Sometimes our systems are outdated, technology systems that are not well suited for Medicaid billing. But at the end of the day, it comes down to sort of that lack of expertise of doing it. So then the question is, well, how are other states overcoming this? If other states are doing it, why is that happening? And you've touched on some of that why already. One of the big reasons why is that in other states, those dollars are coming directly back to the school district. So the incentive is my district receives increased funds. Here we're talking about the savings going to the state. So that's certainly a difference. But also in other states, there are things that happen that are not in this bill, which tend to be that centralization that I believe Representative Provenza was referring to of process. So some states have adopted a centralized billing that happens either through a Department of Education or Department of Health or some other entity where it's not the school district, but it's the state entity who's doing that. Now, I wonder if some of the reason that we see it written this way, especially if you look through the bill, it describes a process where the school district is going to apply for the reimbursement. The school district is going to receive the reimbursement. Then the school district is going to send that reimbursement back to the state, and then the state's going to kind of even everything out. So one wonders, is that the most efficient process? Should it just go directly through the state? And perhaps one of the reasons it's not written that way is that Medicaid reimbursement usually goes to the provider. And so if the state's not the provider, I don't know if that's a reason why we're not going that way. But if we could centralize it, if we could streamline it, that's a potential way of saving that. So automated billing systems, electronic health records, staff training, external partnerships, collaborating with medical experts or consulting firms that have specialized knowledge and support to districts. These are the steps that other states are taking. Also, templates and checklists. Other states have developed standardized templates and checklists to ensure consistent and accurate documentation. Automated verification of eligibility and updates. Also providing security training, HIPAA compliance training. But the place that I think you perhaps see the biggest difference is when the state's not doing it itself, there's typically a third-party administrator who's doing it. So it's very rarely the school district is engaging in this independently. Whether the school district contracts with a third-party administrator or the state contracts with a third-party administrator, that's usually the best solution. I can tell you that's exactly how it works in Alabama, because the Alabama School Boards Association is a third-party administrator for Medicaid billing claims in the state of Alabama. So they work with districts essentially to help the district save money, and then they charge as that third-party administrator. So, Mr. Chairman, there are some things that we can do to help reduce that administrative burden, but ultimately it's looking at how can we be efficient with that cost, and instead of each district having its burden, is there a way to centralize that either through state agencies or through third-party administrators? Dr. Brown?
Mr. Chairman, Boyd Brown, Wyoming Association of School Administrators. If you've not read Appendix A and looked at what Crook County is doing, I think their story and theirs is a nice one. They're going to continue to try to get the training and do that this year. But I think that it's difficult to try to get our staff up to a level that they feel proficient to be able to do that. As most of you know, Medicaid fraud is something that's huge, and I think we have people that want to do it right, but are concerned that it may not happen right. The burden of having to stand this up by July of 2025, which is in the bill, I think is very difficult. So I would suggest, if we're going to do it, that we give districts a little time to get that done, maybe 26, 27, to get the training that every one of those districts is going to need. Again, I don't think we're trying to be block it or anything. I think the issue is just trying to make sure that we have the expertise in our school districts to be able to do what we need to do, or having a centralized organization that can do the things that they need to do. And with that,
Mr. Chairman, one last issue, if I could.
Please go ahead.
In the previous discussion, the Department of Health talked about expanding the definition beyond special education services. So again, remember how funding works in Wyoming. Special education services are reimbursed by the state. So to the degree that we keep it contained to special education services, this savings to the state is clear. But if we expand it out beyond special education services to those routine health services that may be provided to students by school nurses or whatever, there's a real question, does that money then go back to the district, or does that money then go to the state? Because we're not talking about the special education reimbursement here, so it would be very unclear if that intent was for that then to go back to the district. Again, that would be our traditional experience across the nation, incentivizing that sort of behavior.
Questions for the gentleman?
Yes, Mr. Chairman.
Go ahead, Representative Berger.
Thank you, Mr. Chairman. And gentlemen, thanks for being here. I have a question. Are school nurses provided through the funding model, or is that up to the district to decide whether they fund their own school nurses?
So, Mr. Chairman, school district nurses, that is a model component. Some districts certainly choose to go beyond the block grant model in the provision of nurses, believing that there is a local need for a greater resource. And there is certainly an interesting question of the degree to which school nurse services might be reimbursable as special education services. And so that's an issue that's also done differently from district to district.
Thank
Okay.
you.
Chairman Scott.
Mr. Chairman, the school statewide administrator idea, I can see where that could relieve some of the burdens, administrative burdens on the district, but you would still have the relevant professionals and teachers involved identifying which kids are on Medicaid and documenting what services are provided. Would you not still have those burdens on the local school district?
Go ahead.
Mr. Chairman, absolutely. There's still a shared burden. This is just one of the ways that some other states have chosen to address it, to reduce the burden. It does not eliminate the burden.
Representative Provenza, did you have a question? Okay. Anybody else? Thank you, gentlemen. Appreciate your,
Mr. Chairman, again, I think Senator Scott brings up a good point there, that we still have the issue of the range of poverty that we would have to try to figure something out there as well.
thank you.
Statistically, you know, we keep trying to put a number of finger a point on this. Just for some understanding, I do think that the memo that LSO put out for you is helpful to look at, because you see the student numbers and then they give you sort of a cumulative percentage, so that as you get to about that 10th or 9th school district, you're talking about 60% or so of the kids in the state. Somewhere between 13 to 15% of our kids receive special education services. But we don't know how many of those 13 to 15% of kids would be Medicaid eligible. That's still an unknown question, and we don't know what the distribution within districts would be without further research.
Good. Representative Claus.
Thank you, Mr. Chair. Thank you, Mr. Farmer. As far as the students should already be qualified for Medicaid, right? I mean, if they've been seeing a physician or a dentist or an eye doctor, that Medicaid qualification, I believe, should already be put in place. Do you have any thoughts towards that?
Mr. Chairman, for many kids, that would be true, to the degree that their family has sought out that sort of support. To the degree that we have kids that are eligible for free and reduced lunches who do not apply, we may also have kids that are Medicaid eligible who have not previously applied for that, but do meet the eligibility requirement.
Anybody else?
Mr. Chairman, one more question.
Representative Berger, go ahead.
Thank you, Mr. Chairman. And I guess where my question is reporting, is it legal to ask or require a family to report that they're receiving Medicaid services? Is that legal?
Mr. Chairman.
Is that why we're not getting every family to report that? Or is that information that can't be reported to us?
Mr. Chairman.
Go ahead.
I think it's legal if we tell them it is. I think we're the ones that decide that.
Okay. Thank you, Mr. Farmer. Please state your name and who you represent.
Sarah Bieber, myself, Casper. Just a few things. In my professional life, I'm a nurse, and there are students that require nursing intervention. And if we're talking about billing Medicaid that pays pennies on the dollar for nursing services, let alone PT/OT services, and the kids that are higher end that require their days are 80-90% therapies and not dominated by education in itself, that's a pretty big span, but it's a very small percentage of student. At what point are you going to start billing private insurance At what recapture are you going to have everybody declare their insurance status to attend public school? I don't bill insurance. The places that I've worked for, the entities that I work for, have entire organizations within their organization to do medical billing. That's substantial ask for a school district, let alone a small school district in Wyoming. That would be a huge task. And to figure out and find somebody that medically bills appropriately and doesn't just try to get the best deal or move the numbers or whatever, like that in itself is its own kind of investigation. I think that this is very misplaced. I don't like that it is specific to one population of student over another. Are we not going to allow private insurance students to get PEG tube service when they have one because they have private insurance? Like, no, we're not going to deny them that. We're still going to give it to them. So then who pays for that? Not their private insurance, because we don't have a bill that says that their private insurance gets billed. Like, how does that work? Another thing, I don't think it's appropriate to ask a family to disclose it. And what if they have dual insurance? So you have a non-custodial parent who intermittently has insurance on a child, and the custodial parent has CHIP on their student. You have to go through the non-CHIP before you go through the CHIP insurance or Medicaid insurance, depending on what it is. So how complicated does that get at that point? Because if you bill Medicaid and it gets kicked back because they have a different insurance, but that insurance has since been discontinued, you're in a roundabout for months with payment. Who chases that? That is like a full-time job in itself. I just am very concerned about this whole thing. That's all I had.
Thank you.
Thanks.
Anybody have questions for Sarah? Representative Provenza.
Thank you, Mr. Chairman. I think it's important to point out, this is reimbursement. This is a system that is set up. Schools can already get this reimbursement. It's something that is essentially a partnership with federal government to ensure that we are funding special education. There's no one in this room who is trying to say that we shouldn't provide services for students that don't have insurance. These services are given to these children. There's no one in this room who wants to bring in private insurers. We are simply trying to do the most fiscally conservative thing by getting our money back from the federal government, from taxes that people pay to help fund education and the services that we are obligated to provide.
We won't, I completely, oh, sorry. Chairman, Representative, we wouldn't deny a student to have these services. So why does it matter what insurance they have? So I don't see the benefit in us chasing down dollars when it's going to cost a substantial more amount of money to chase down or get reimbursed for the amount of money that we're spending. If it's already guaranteed to have been reimbursed to us because it's special education, then why add that burden? In the memorandum, on the second page, Fremont County replied, and they state specifically in there, the CPT codes, the administrative work, I think it's an occupational therapist, it might be speech therapist, but in that, it talks about how that is way too difficult for their school district to even attempt to do it. And they have a large school district. Natrona County is a large school district, and I don't think that they would be adequately equipped to do something like that. We wouldn't deny services, that's kind of the point. So why do we need to chase down money when it's already granted?
No, don't go there. Thank you. Anybody else? Welcome.
Mr. Chairman, Paige Fenton Hughes, Superintendent in Douglas in Converse One. I just wanted to maybe address a couple issues because we are doing the Medicaid billing. So I got to get my glasses on so I can read my notes, but I think Representative Obermuller, you asked, what's the burden? I'm going to be probably the last person to tell you I know exactly what it is, but when I asked the person doing it for us, I got a packet of information. Senator Scott, you're right. All of our people out in the field working with the students have to track that, submit that, send that in. So you're exactly correct about that. And I think maybe a way to look at it is, and I think Shelley can answer this, but I think 5 school districts started and we're the only ones standing. So it's not easy and it's not fun. But I think our reimbursement, the first year we did it was around $40,000. We have around 1,675 students in our district. I can't tell you the percent that are Medicaid eligible because I see maybe you're going to ask me that. I don't know. And then I think last year it was around 34,000. So that's how it kind of impacts a district our size. I do want to echo to you all, if you do it, that Boyd is right on point. It takes a long time. It took us a long time to get it up and running. So I feel like by the time you all would get this legislation through, say, first part of March, there's almost no way districts could do it by July 1st. So, and Mr. Chairman, can we go back to mental health? I know you're going to hate me. Can we?
If you'd like to comment, go ahead.
Okay. I would like to say just a couple things about that. I want to answer Chairman Scott's question about students with serious mental health issues, whether those are often or sometimes caused by academic issues. So I think when Representative Larson was saying, you know, students who go to residential treatment center or to a PRTF or something like that, in our experience that I can ever recall, 0 of those have been academic issue. So.
Go ahead, Chairman Scott.
Mr. Chairman, you're misconstruing what I said.
Okay, good. You can help me then.
I was trying to separate, I think, the very serious illnesses. Those are organic. They're illnesses that have nothing to do with being in school or out of school. They may occur in school because they occur in that age. The lesser illnesses and problems, I think, are the ones that might well be caused by inability to do the schoolwork.
Mr. Chairman?
Go ahead.
Chairman Scott, I think that's possible. I think it's highly improbable. It's almost always caused by trauma. That trauma for a student is different, but I don't think that's it, but it could be. With regard to the framework, prevention, identification, and referral, I was very happy, Mr. Chairman, to hear that, because that's what we do. And I want to echo Senator Baldwin's comments about focusing on prevention. That is the key. And some of that, I agree with Senator Scott, is about success academically, absolutely is. And sometimes being successful academically means mitigating the trauma so you can learn. We have processes in place, but we're always looking for support and research and ways to do it better. And that identification piece, well, let me go back to the prevention piece. We are a pilot district for BARR. We've just started, so I can't really tell you anything except sitting in that initial training and hearing the research and presentations that you all have heard, and then we had one in our district. We are hoping for that to be something that can grow into part of that preventive piece. And I think Superintendent Degenfelder testified to the way it works into that academic piece that is addressing, I think, Senator Scott's concern. Regarding the identification piece, I just want to say we don't have teachers in rogue situations or silos. We have a process for that, and our teachers aren't providing treatment, but they are identifying problems, and that's based a lot on their close relationships they build with students. And it's not just our teachers. It's our counselors. It might be a lunch person. It might be a custodian that oversees the lunchroom. It's our bus drivers, first people and last people to see our kids every single day. And our adults know how to identify issues with students, and we have a process for that. And we surround them with support. So there isn't, I think, a large gap between what happens in schools and what's communicated to parents. We communicate with parents immediately because they are the most important cog in that wheel to help our students. Unless, of course, and I think you're all aware of this, that they're the cause of the trauma. And we do make referrals. We aren't a treatment center. We don't try to be. And we certainly agree that we don't want to turn our schools into being, totally mental health providers. But there's a long time between a referral and getting help to our kids. Please be aware of that. So they're in crisis, and we are calling on all the resources we have. And sometimes that resource ends up late at night being our ER. Because when we make that referral, and Representative Larson alluded to this, there is no one on the other end of that call. So, and when I testified at the Mental Health Task Force, I was asked, can you hire support people? And we can, and you know where we hire them from? Other providers. So we're hiring them from DFS, we're hiring them from a counseling service, and sometimes that's because we offer better benefits or they want to work with kids or whatever that is, but we're hardly ever adding them to the cadre of professionals to support our kids, if that makes sense. So I think the last thing I would say is that it concerns me when we focus our language on what's being done to students instead of what's being done for them. And the focus of my people in my district every single day is doing things for kids. My people love our kids. And they work with our parents. They don't work against parents because we need parents to help our kids. And trust me, they have needs. And some of them, their biggest need isn't the reading lesson for the day. They need cared for first. And sometimes they need fed first. Sometimes they need their clothes washed first. And that's just the reality. And my people do it every day. And they do it for kids, not to them. Mr. Chairman, thank you.
Thank you for your passion for education.
Mr. Chairman.
Representative Berger, please go ahead.
Superintendent, thank you for being here today. I appreciate it. I guess I have a question. Are you better reporters, as your staff better reporters today because of the changes in statute for the new parent laws that we're supposed to make with your district? Are teachers and your staff better reporters now because of what we changed in legislation?
Go ahead.
Mr. Chairman?
Go ahead.
Representative Berger, the word I was used is not better. So my people were reporting before what needed to be reported to parents. Now they're scared not to report things that just take up their time. And I will tell you that just about an hour ago, I answered an email from a school nurse about calling a parent about a Band-Aid because they're scared about the language. So part of that is we have to do a better job of going through our policy and explaining the definitions and when that needs to happen. But better is not the word I would use.
Mr. Chairman. Thank you. And scared is the exact word I was looking for from you. And that's how we're feeling in my district. We're scared. Thank you.
Thank you.
Thank you, Mr. Chair.
Okay. Anybody else, public comment on the bill? Anybody else? I'm just gonna close it.
I'd like to comment a little bit on the mental health as well.
You pull the mic up a little bit.
I've been waiting to comment on the mental health as well. My name's Kelly Bridges. I'm here perhaps as one of the few parents with young children. I'm also an attorney, and I've looked into a lot about these programs we talked about today, Project Aware and BAR, and I wanted to make some comments. Mostly, I came here with a list of questions about them. I've done a lot of research into them, and I don't have a lot of answers that I've gotten today. Specifically, I'd like to know, and I'd like you guys to find out, what exactly the purpose is of these programs. Is it to reduce suicide? Is it to help loneliness? Is it to help with trauma? Is it food insecurity? Is it bullying? Because these programs indicate that it's for any manner of those issues. And I think we need to really understand what we're trying to implement. Also, what curriculum do they implement? BAR has curriculum. And I know that they said that they would offer it. I don't believe that any of the legislators have seen it. And I think it's important that when we're paying for and providing curriculum to districts, that we know exactly what's being implemented. We need to know what it looks like. How are students' needs being identified in these programs? Are there assessments and surveys? And how often are they administered? What happens to the documents that the kids do the surveys on? Where are they stored? Where is that information put? And who are the responses provided to? Are they given to the parents? Is that data shared with anyone outside the school? I think these are all questions that we need to ask and understand before we move forward with a statewide implementation of these programs. There's been a lot of discussion about parents' rights and some frustration with them as well, which is disheartening as a parent. My question is, and your question should be, do these programs require the school district personnel to encourage a student to discuss issues relating to his well-being with his parent or guardian, or to facilitate that discussion with a parent or guardian, as is prescribed in the new Parents' Rights Bill? Or do these programs encourage students to confide in teachers, administrators, and counselors? If these programs are systemic, which they are often said they are implemented systemically, and universally applied to all students, how can parents opt out? These are questions that need to be answered. Additionally, with regards to data that is collected, one objective of these programs is basically, how do we evaluate these programs? Is it subjective? One objective of these programs is increased social connectedness. How does one measure social connectedness? Can these results be proven, or are they just merely correlations? Is there data that we can actually look at that proves that there is improvement in academics, that proves that there is improvement in non-academic behavior? Or are we merely making correlations? Who is actually implementing these programs at the ground level? BAR trains all teachers on how to implement its program on a daily basis. So teachers already report that they are overburdened. Yet the WDE thinks that we should add to their responsibilities by training them to recognize and identify mental health issues and then report those to the administration. Is training teachers to be frontline mental health providers really what we should expect of them? Is it the proper role of the school? In fact, in listening to the mental health task force meetings, which I have done, Department of Health Director Johansson expressed his concern in keeping healthcare out of education. I think we need to recognize that and address that concern. How are these programs, Project Aware and BAR, different from other mental health programs that we already have? Redundancy is an issue. WD provides other programs such as Thrive and Wyoming MTSS Center. Are these new programs redundant? Most districts already provide some level of counseling, MTSS or social emotional learning. Are these new programs necessary? Are they different? We need to find that out. Additionally, do these programs respect local control by districts? To my knowledge, WDE does not choose curricula for districts in other subject matters, for example, English or math. The legislature is not asked to consider or pay for curricula in other subjects, to my knowledge. Why is WDE choosing the mental health programs the state should pay for and provide to districts in mental health? Perhaps most important is the cost of these programs. I will get to my conclusion soon. The WDE's cost proposal to implement these programs statewide is $13 million for AWARE and $68 million for BAR. That is statewide. Can we afford these programs? The Mental Health Task Force and Vulnerable Task Force is only proposing a limited rollout of BAR for now. But isn't the plan to eventually try to implement it to all Wyoming schools? Contrary to what has been said here today, these are not Wyoming solutions for Wyoming problems. BAR, I believe, comes from Wisconsin, and the two other programs that I mentioned, Thrive and AWARE, are evolved directly out of grants directly from the federal government. These are not Wyoming solutions. Public sentiment in Wyoming is very clearly in favor of parental rights, limited government, reduced government spending, and reduced bureaucracy in our schools. These programs go against each of these issues. On top of the obvious parental rights issues, these programs create an undue burden on teachers who may even be subject to civil liability by creating a duty to report a child's perceived psychological issues. These are things we should consider. It is clear that we have insufficient information about these programs. Before approving them, I challenge each of you to try to explain to your constituents what these programs do, what problem they are intended to solve, how they will solve them, how they are implemented in schools, and why the substantial cost is justified. I am here to respectfully ask you to do your due diligence to understand what it is you are getting for our money. Thank you.
Thank you. I didn't catch your name.
Kelly Bridges.
Thank you, Kelly.
Thank you.
All right, public comment on the bill, please. Anybody else? None appearing. We'll close public comment on 25 LSO 0095. Mr. Chairman. Chairman Scott.
Okay, Mr. Chairman, I think we're going to have to carry this bill over because to make an intelligent decision on it, we're going to have to see how much they're going to bring in and how much it's going to cost us, and we don't have the how much is it going to cost us. It's one thing if it's 10 or 20% of what we're going to earn. It's a very different thing if it's 70 or 80%. We think it's less than 100% because so many other states have done it. But we still need to have that before we can make an intelligent decision. Mr. Chairman, I'm going to suggest we work the bill so that we can make those estimates based on a more final version, not a final version, but a more refined version. So if it's all right, Mr. Chairman, I got some amendments to propose.
Okay, but if we do that, we got to move the bill.
Okay, I'll move the bill. I'll move the bill for moving it to next meeting.
To the next meeting, okay?
Okay.
Second? Is that a second, Bo?
No. Sorry, I was.
Second?
Do we not want to move the bill?
Nobody going to second? I'll second it then, just to move it and get some more information.
Okay. Mr. Chairman,
Please go ahead.
I'll make them as one amendment, but they're very divisible. First element is to add the words "and CHIP" as the health department recommended. That's a very simple amendment. It doesn't increase the complexity significantly. It just increases the result in terms of revenue. Second amendment is to provide that the ability for the State Department of Education to hire a third-party administrator to handle the administrative functions statewide to the extent they can be handled. The third amendment would be to change the effective date from July 1st, 2026 to July 1st, 2027, with the ability to do the necessary preparation work in the intervening year. So that would require a little extra work on the effective date, Mr. Chairman.
You have a question? Go ahead. Go ahead, Representative Provenza.
I just, for clarification, I thought the motion was to consider this at the next meeting. And now we're effectively working the bill right now, so I think it's out of order to work the bill if the motion is to
could be.
consider this at the
It
next
could be,
meeting.
we probably have one motion on already on.
Mr. Chairman,
Oh, we have,
the suggestion was that we needed a motion on the bill so we could work it. And the motion was to carry it forward the next meeting, but we need to work it so we have the information we need for the next meeting.
go ahead, Representative.
Mr. Chairman, I think what would be more proper in terms of procedure would be, I think we can have discussion about what we would like to see amended for the next one, but if the motion is to work the bill, then what are we voting on at the end? To
Then carry it forward.
Carry it forward to the next
carry
meeting.
it forward
With
with
those
the
amendments.
amendments?
Yep.
Okay, I just want to make sure we're all on the same page.
And he's listed the amendments.
Okay, great.
Representative Lawley.
Thank you, Mr. Chairman. I think it doesn't simplify completely to just add CHIP in. You're going to have to say something like for special ed services, because that CHIP's much broader than special ed services. So again, I mean, that, one way or the other, it doesn't necessarily simplify it. Because, again, there are things that the CHIP pays for that are not special ed services. So we've got to keep it within the realm of special ed services without, if we don't want to complicate it.
Go ahead, Chairman Scott.
Mr. Chairman, that's already there. If you just add these words Medicaid and CHIP, you aren't expanding the services that are eligible. You're expanding that it's both Medicaid and CHIP, and it's the same services. So it does work without having to amend that further.
Mr. Chairman, I think the question is, it's related to special education services. Your addition, adding the CHIP component is still further refined by special education services, correct?
Mr. Chairman, that's right. There's another potential amendment the Health Department recommended that I didn't make that would expand the services. But that's not what's on before us right now.
Okay. Further thoughts, questions, comments? All right. Everybody understand what we're going to vote on? We're going to vote on whether or not to push this bill into the next meeting with these amendments, these three amendments, which is to add CHIP as the Health Department has outlined on the handout, provide State Department to hire an administrator for this, and the third one was to move the effective date to 27 and 20.
Mr. Chairman, one refinement, it's not as, I don't believe the motion was as recommended by the Department of Health, but instead a portion of their recommendation, which is only applicable to special education reimbursement.
Okay,
Mr. Chairman.
thanks for clarifying.
Mr. Chair.
Go ahead.
And the effective date is July 1, 2025 to July 1,
Set to 7, yep, 27.
26.
Oh, 6, not 7, got it. 1 year.
Give us an extra year and let us do the necessary preparatory work in the meantime.
Okay. Representative Clauston, go ahead.
Thank you, Mr. Chair. And then the goal of moving this forward is we'll get all the financial data that we requested if we're going to.
Correct, that was the other part of
Thank
it. To get some idea what they're going to save / cost. Okay. Further questions?
Mr. Chairman, just I guess more of a point of order. I tend to agree with Representative Provenza on this. I think this is actually sitting in as your prerogative. The motion to move a bill forward to the next meeting, I think can just be done at the chairman's prerogative at this point with the information that you guys have done. I don't think this requires a vote. You've given direction as the chairman to LSO to incorporate changes and do that forward. There's no vote necessary here because we're not actually working the bill. We're not actually doing anything with the bill. So, I mean, if it makes the committee feel better that we're voting on this to move it up or down right now, that's fine. But I also think that the chairman has the prerogative to just direct LSO to incorporate these changes and move it forward as is.
Thank you for that clarification. All right, so LSO, we'll just do that and we'll move the bill forward with this amendments in it, just clear, and see what, and also would you find out what the
Mr.
costs are going to
Chairman,
be? Or the
point of
same?
order. Shouldn't we at least vote on these proposed amendments, or are we just going to declare that we all agree on them?
Okay, we'll vote on the amendments.
Okay, thank you.
Well, that motion now is to that part. Okay. So all those in favor of the amendments signify by saying aye.
Aye.
Those opposed? I believe the ayes have it. That motion's passed. Okay, so now we're up to, gotta get my agenda out of here. K-12 mental health services. Mr. Shaner? He's still on. It's all yours.
Yes, good afternoon, Mr. Chair. Thank you. Sorry I was not able to be there this morning. Had a family health situation, but it is all going well. So we're out of the woods on that. Related to the K-12 mental health service grants, this session there was a bill passed that appropriated $10 million to the Department of Education to distribute grants to school districts based on their ADM for this upcoming school year and the year after. So what we're going to do is do 5 million this upcoming school year or this current school year, and then 5 million next year. And then every district is going to get a proportional share based on their district's ADM compared to the state ADM. So it's just going to be a proportional per pupil distribution of 5 million each year in mental health grants. Those, the other criteria related to this is that we're going to be, monitoring or collecting information on the implementation of whatever they choose to do with these grants. So we know they're going to be doing things like different curriculum purchasing, different training of their staff, different clinical interventions. Every district will do something a little differently. And then we're gonna collect information on exactly what it is they're doing, how many individuals do they have trained, what policies are you doing, et cetera. And then also when it comes to sort of gauging the impact of the services that they're providing to students, we have a survey that's attached to the memo we provided, which is just kind of a real brief survey to gauge how the interventions are working for the individuals that are serviced with the program. So you can see that it's a 6-question survey, and then we'll be collecting that information as well as the other data I mentioned. And Mr. Chairman, that's the bulk of the grant program.
Any questions for Mr. Shaner? Committee? Okay. Thank you very much. Any additional public comments on the K-12 mental health generally? Seeing none. Committee, anybody going to propose any bill drafts in this area? Seeing none. Basically, I think it's time for us to take a 10-minute break, and then we'll come back and we'll lead off with charter schools. And we are going to run a little late tonight.
You ready? If everybody take their seats, we'll get back at it again.
It's not a bad bell.
It's not a bad bell. It is.
Children?
So we are on charter schools, 25 LSO-0093, and charter schools as LEAs. Tanya Hytruck will be presenting the bill. Thank you.
Mr. Chairman, members of the committee, this is related to agenda item number 8. As you stated, it is 25 LSO 93, committee formal draft 1.1, charter schools as local education agencies. Recall that this was drafted by LSO in response to the committee's directive at the June meeting, and it was discussed at that meeting, but I'll refresh your recollection that a similar bill was vetoed by the governor that was passed by the legislature during the 2024 session. Although that bill had an additional component related to payments to charter schools that is not present in this bill draft. One item that I would note as a side note is that the bill draft is patterned after 23 Wyoming Session Law, Chapter 82, which authorized BOCES to act as local education agencies. Walking through the bill, page 1, line 11 through page 3, line 5, creates a new statutory section within the Charter School Code, 21-3-315. Subsection A, found on page 2, lines 4 through 12, directs that charter schools approved to operate by a school district may act as an LEA. That's a permissive inference to apply for, receive, and administer grants, either received by the state or through the federal government. Lines 8 through 12 further specifies that charter schools approved by the Wyoming Charter School Authorizing Board shall act as the LEA. It's not permissive, it's a mandatory obligation. Subsection B, created on page 2, line 14 through page 3, line 5, requires the WDE to treat charter schools as an LEA for purposes of accepting funds, and specifies that charter schools are responsible for complying with IDEA and providing special education services. That can be found on page 3, lines 1 through 5. Section 2, which is found on page 3, line 7, repeals the current provision, which, if you recall, currently the Wyoming Charter School Authorizing Board, the state authorizing board, is acting as the LEA. And that provision is, that will be repealed, is quoted on lines 8 through 22. This act is effective pursuant to Section 3 on July 1st of 2025. That can be found on page 3, line 25. Subject to the committee's questions, Mr. Chairman.
Thank you. So can you refresh the committee on what an LEA is so that there's no ambiguity about it?
An LEA is short for Local Education Agency. It's typically an entity that receives federal funds and is required to comply with certain obligations as a condition of receipt of those funds.
Correct. Okay. Chairman Scott, go ahead.
Mr. Chairman, we have an extensive memo from Mr. Shaner at the State Department of Education on what an LEA does. I think we need to explore that and hear from him before we proceed further on the bill, because I think there are some significant administrative burdens that are involved that I don't understand. I suspect that many other members of the committee don't understand exactly what we're talking about in terms of those burdens.
Mr. Chairman, Chairman Scott is correct. I believe Chief Shaner will also speak to the impetus for the bill as well. I know that memo sort of explains the background of how we got to this particular juncture.
Sounds great. So Chief Shaner, you're on.
Great. Thank you, Mr. Chairman, for the opportunity to speak on this. Just to highlight a couple points from my memo. It is the opinion of the state superintendent that the best model for what we're dealing with in Wyoming, with the amount of state authorized charter schools we have and can anticipate in the near future, that the schools themselves be designated as the LEA. Now, there was consensus from the schools, from their association on this in the previous session. This move was vetoed by the governor's office. And since then, I would leave it to the schools to, testify as to what their preference is. And ultimately, the state superintendent wants what's best for the schools, what makes the most sense to them, our 3 state authorized charters, and soon to be our 4th state authorized charter. So I just want to open with that in essence, this is a best practice bill, but ultimately we want to help the schools be successful and work with them on what they think will work best. From the research I've been able to do, there are about 20 states that have a state authorization pathway for charter schools, and about 4 of them have the state authorizing board be the LEA like we have right now. The others, it's a mix of either the school itself is the LEA or the school's tied into another LEA. And so it varies from state to state on what that looks like. Now, this discussion of an LEA and what is an LEA, it gets a little bit tricky, but I think what I try to do is just reiterate or remind myself and people that I'm talking to, like LEA, most of the time refers to a school district. It's a federal term to describe a school district. However, an LEA does not have to be a school district. It can be other things. We actually have 48 school districts in Wyoming, but we have 50 LEAs because we have made the Behavioral Health Division in the Department of Health through statute the 49th LEA. And so that was done in Wyoming statute because the federal definition of LEA can be something other than a school district. And then the 50th LEA is the Wyoming Charter School Authorizing Board. And really what that means is it's a federal designation for purposes of federal grants and federal programs. And that attachment in the memo I sent, we tried to do was work with our team, get all the major federal programs, all the title programs, Perkins, IDEA, try to put some of the biggest sort of responsibilities for each of those title programs into that memo so you could see the work that goes into applying for, accepting, and then the accountability and monitoring associated with accepting that money for you to just see what that would entail. The reality of the day-to-day is that we at the department work through the board as the LEA to get to the schools within that LEA, the 3 charters. Right now, we work through the charter board to help them get their whatever applications they want to submit, whatever federal funding they seek to receive, and then of course the IDEA funding around special education. We work with the schools on a daily basis to help them do all of this work in the memo. And it's our opinion that if they were the LEA themselves, it would streamline that process and make it less cumbersome because we could work directly with the schools, get them the money directly, get it to them quicker versus having to funnel it through the board down to the schools. That's really the difference, is just the efficiency of being able to give the funding directly to the schools as opposed to having to send it through the board then to the schools. So happy to try to answer any questions on that, Mr. Chairman.
Questions for Chief Shaner? There we go. Senator Beitman, please go ahead.
Thank you, Mr. President, or Chairman. You can be president today, too. I was just wondering, I was reading through the veto message, wondering if the chief executive's concerns have been addressed about the baling wire and some other things he talked about. Would this bill take care of his concerns?
Mr. Shaner, do you think that it's been addressed appropriately in the bill, the veto concerns?
Yeah, Mr. Chairman, through you, Senator Beitman, I'd have to review that veto letter. I haven't looked at that in a while. I could certainly look at it, but the proposal hasn't really changed from the session to now, other than, I don't think would be substantially different from what was proposed in the session.
Janine, how are you doing?
Thank you, Mr. Chair. Janine Bayteski, I'm the chair of the Wyoming Charter School Authorizing Board. Senator Beitman, to answer your question is, no, we don't believe that we have advanced enough to be able to say that things have changed significantly so that the governor wouldn't veto this again. We are in the process of trying to bring on board an executive director. I think we need to get that person on board and see how that works in terms of the interface with the 3 schools now, and take it from there, because at this point, we just don't know enough to say that it doesn't work. We're using the Charter School Authorizing Board. So we're just concerned that people were going to use time, resources to move this bill forward, and we'll end up in the same place where we are today.
That's not very good. Any other comments, questions? Anybody have anything for Mr. Shaner or Chief Shaner or Janine Bayteski? All right, we've had water thrown on the fire. Huh?
Mr. Chairman, are you going to open this up for public comment?
I think that's the next thing to do, is right. Public comment? Anybody want to comment on 25 LSO 0093, charter schools as an LEA?
Mr. Chairman, Carrie Klein, I'm with the Wyoming Public Charter Schools Association, and I will make a couple of comments, so thank you for the opportunity. I'm going to start out by saying that the state-authorized charter schools were ready and capable, felt they were capable to serve as the LEA for their federal programs. This will be the second academic year that the Charter School Authorizing Board is serving as the LEA for these schools. And the priority for the schools at this point is really to work with their authorizer and the Department of Education to ensure that the process that's started and is moving forward continues to improve. Additionally, we will continue to work to strengthen policies that give public charter schools autonomy and accountability so that they can really focus on serving and educating their students. So happy to answer any questions. I will concur with the chairwoman of the authorizing board. Our schools at this time are feeling like they would let this process work this year and work to make that better and focus on some other priorities at this time.
Okay, questions for Carrie? Ms. Klein, I'm sorry. Thank you. Any other public comment? Any other public comment? All right, we'll close public comment. Committee, what's your pleasure on 25 LSO 0093, charter schools in the LEA?
Mr. Chairman?
Go ahead, Representative Brown.
I recognize I'm not in the room, so Mr. Chairman, I would move to table this bill indefinitely based off of some of the other discussions that I've heard. So I would move to postpone this bill indefinitely.
We have a second. No discussion. Let's take a vote. All those in favor signify by saying aye. Aye. Those opposed? No. Sounds to me like there's only 2 no's. Okay, we've tabled this bill indefinitely. That helped. We'll move right along now. We are on item number 9 on the agenda, reimagining and innovating the delivery of education in Wyoming, future of learning. We're back to,
Mr. Chairman,
yes?
you do have
Oh, I missed
Ms.
one.
Bayteski on the agenda
Yeah,
again.
I missed one. I'm sorry. We're at Wyoming Charter School Authorizing Board recommendations. Yep, that's where we are. Sorry, I missed one.
Thank you, Mr. Chair. Well, let me begin by just giving you a brief update as to where we are right now. We officially opened the third school on August the 23rd, which is the Cheyenne Classical Academy. Last I heard, which was about 2 weeks ago, they were at an enrollment of about 176 students and still had a little bit of space in some grades, but they're moving forward. In addition, it's sort of an exciting time because this is our first spin at working on the applications. At the end of July, we received 2 applications for, if you recall, Senator Dockstader brought forward an amendment to the budget, which allowed the pull ahead of 1 application. So staff, it's presently under review by staff. The board will get that recommendation or the review from the comments on the review from the staff on the 30th of August. The board will be conducting interviews on September the 17th in Cody and September the 18th in Alpine. And our approval of one of those 2 applications, if we so choose, we could choose not to approve either one, would be on October the 10th. Okay? Any questions about where we are?
How's the enrollment in the other 2 schools?
I have those numbers for you. So when we went to the ribbon cutting for, or the groundbreaking for the Wyoming Classical Academy in Mills, they closed the school year at 219, but they are anticipating a large enrollment uptick this year. They thought perhaps another 100 students. Prairie View at last count was at 55. And they are also anticipating an increase in their enrollment.
Okay. Chairman Scott, you have a comment?
I have a question, Mr. Chairman. Looking forward to the future on charter schools. In the smaller communities, is the charter school, does it look like it's going to provide an answer for communities that feel they're being ignored by the majority community in the district and getting the essentially poor results because the majority community has been ignoring this other community? I think that may well be an issue in some of the areas that and is that going to prove to be a valuable thing, or are they defeating the consolidation that we already have in school districts?
You know, Senator, excuse me, Mr.
Right
Chair,
ahead.
Senator Scott, that's an interesting question because as you're aware, 2 of these, you know, the school in, the Prairie View School in Platte County certainly falls under that. And I think the Alpine application also falls on that. I will say the Alpine application, for example, has a letter of support from the school district. So I can't really judge on, you know, but you've brought up an interesting point, which is something that falls into my recommendations, is that when you start looking at those schools, let's take Prairie View, for example, the way the model is and the way the legislation has been written, transportation, for example, is reimbursable. it is really difficult for those startups that have no reserves to be able to put a transportation plan in place at the opening of a school. And the issue is further complicated by the fact that, you know, in statute, there's a thing called isolation payment, which says that if, you know, there's no transportation available, parents can get reimbursed for transportation. Isolation payments are also not available to state authorized charters. So I think, as one of my recommendations, that's really something I think we need to look into. Is there a way for us to have some sort of a reserve somewhere to address the reimbursables, for example, special education and transportation?
Mr. Chairman,
Go ahead, Mr. Chairman.
can I generalize what you're saying is saying we have a problem with new charter schools in them having adequate working capital to get going,
That is correct.
beyond just the transportation issue?
That is correct. So, and you know, so I kind of reflected on this because, as you well know, we used to say, well, we'd give double payments the first year, and I kind of thought at the time, well, that's kind of generous. But now, as I reflect on it from this vantage point, I understand why we did it. For this very kind of an issue. So,
Mr. Chairman, I would suggest as we go forward, we're going to need to think about that set of issues, because I think it is a general problem.
so one of our other recommendations is, as we go about bringing our executive director on board, we find it to be really important that the Charter School Authorizing Board has its own autonomy, that it isn't sucked into the Department of Ed or isn't put into the governor's office, that it is a board of itself that can work outside of the external environment to be able to provide the best services to these schools so that these schools can provide the best services to these students. Because keep in mind, at the end of the day, you know, there's a superintendent that Chairman Northrup, I think you're aware of, that used to always say, when the decisions get tough, you think about what's best for kids. And so, you know, I just encourage us to take that approach to things. So we really, like I said, we really find that to be an important aspect of where we're headed. And, you know, as Deputy Shaner said, one of the key responsibilities of this executive director will be to ensure that the schools understand. I look at this model as sort of an inside and outside model. We have a resource within the Department of Ed that is in the statute, or in the legislation, as our liaison. That person is responsible for making sure that they can provide resources to the schools from within the WDE. The interesting missing piece in all of this is, so how do we find out what the schools need? And that would be, in my view, what this executive director would be, the outside resource, which would be primarily responsible for interfacing with the schools to make sure they're meeting the timelines of things, due dates that they need, for example, filing of reports and so on and so forth. They understand the grants that are available to them and have the wherewithal to be able to apply for them, that kind of thing, which I think is really important to reinforce the success of these schools. And lastly, I think that we need to clean things up and look at some of the things in legislation that has been written that sort of limits the funding of these charter schools. For example, as I mentioned, isolation payments are not in there. Teacher extra duty pay, which schools are entitled to for trainings, for mentoring teachers, for whatever, are not available to the charter schools. And then there's central office funding for stuff, for example, supplies and so on and so forth, that I think that there's a share of that that perhaps we should think about should we be providing some central office funding to these charter schools? You know, the job doesn't go away. They still have the state reports to file. They still have the grants to write. They still have those work tasks to do, but yet the staffing isn't there. So that's my recommendations as we're moving forward in the short term.
I guess my question is, will this wait until we do recalibration? Or does it need to happen before recalibration?
I would suggest it probably should happen before. And for, Mr. Chair, for another reason, it will simplify recalibration, because then all of those line items will have, you know, you won't
Right, they'll be able to be worked into the model.
be going back at the exception for,
Yeah. Representative Provenza.
Thank you, Mr. Chairman. So it sounds like there's grants available to charter schools. I'm wondering, are those grants things that like we can know what they are publicly so that we can see on the other end what are the funds that they're getting from outside sources to match some of the funds that they're getting from the government? How much money's coming in, who's giving it to charter schools, and what's it used for?
the answer to your question, oh, excuse me, Mr.
Please go
Chair.
ahead, you're doing fine.
Representative Provenza, the answer to your question is, of course, because we're bound by transparency. So this is a public school. So consequently, all records are public. So yes.
Go ahead, Representative Clausen.
Thank you, Mr. Chair. Thank you. You know, school busing's reimbursed at 100% by the state. Has there been discussion between the charter schools and their local districts on the districts picking up these kids and having some maybe drop-off points where a bus could pick them up? What kind of conversations have been held on busing?
Go ahead, Janine.
Thank you, Mr. Chair. Representative Clausen, I don't know. I know, for example, when you look at Prairie View, which certainly was the one that surfaced this issue, because of what the district did in terms of they closed that school down and shipped all the kids north. There was no overlap. So there really wasn't the ability to, you know, just pick kids up along the way and just drop them off at a different school. Alpine, I think, will be similar. There will be no overlap. So I don't know at this juncture, for example, if we approved the Alpine application, if Lincoln 2 would be willing to provide busing services for, it's just too early to tell. But, you know, the other interesting thing here is it takes a long time to get a bus. So, you know, you don't have money, and then you got to wait in line besides, so it's, and to me, this is kind of an important aspect for equity.
Representative Brown, you have a question.
Thank you, Mr. Chairman. Janine, just out of curiosity, and this is, as Representative Larson put it earlier today, this is a slow one over the plate. We have charter schools that are capable of getting all this funding that you're talking about and have the capability of doing everything that you're talking about. If they go through the traditional formula of starting a charter school with their local school district, is that correct?
That is correct.
And so all of these problems are because we are facing a way of circumventing the current system. Is that correct?
Go ahead.
Mr. Chair, Representative Brown, I don't know if I'd use the word circumventing.
How would you describe it then? If we're not utilizing the current system, we created a new system to authorize charter schools. I guess what I'm trying to get to is we currently have a system in place that allows charter schools to operate and get the full funding and everything that you're talking about without any issues and or concerns. The issue that we're running into right now, and including the last bill that we talked about, really boils down to us creating a new system to circumvent, in my opinion, using my word, to go around the current system of starting a charter school.
Mr. Chair, Representative Brown, I'm not sure I understand completely why these folks sought to go outside of the district. I certainly understand the Alpine one pretty well, but I do not understand the three that are in existence, why they chose to. I believe Prairie View also that the district really wasn't willing to sponsor a charter. I mean, they wanted to close that school in Platte County.
Representative Lawley, please go ahead.
Thank you, Mr. Chairman. Good to see you, Janine. Could you possibly provide us written down your recommendations? That would be very helpful for me to have them written down as we look at trying to work through some of those. Thank you.
Thank you, I'd be happy to do that.
Further questions or comments for Janine? Thank you, Janine. We appreciate your update.
Thank you.
Okay, we're up to public comment. Anybody like to public comment on anything that's happened under charter schools? Going once. Welcome back.
Hi, Carrie Klein again for the record, Wyoming Public Charter School Association. Just thought, Mr. Chairman, Representative Clausen, I could answer your question on the transportation issue. Generally speaking, charters have the opportunity to enter into contracts with districts to help provide transportation. It is a contractual agreement. Across the state right now, we see there are a couple of charter schools that have been in existence for a while who are now contracting with their local districts to provide transportation. So that's, they have a contractual agreement where the district has the buses, has them in their routes, and the charter school pays them to do that. There are some charter schools who choose not to do that. They could be doing their own transportation, they could be not providing transportation. So just to answer the question, that's how they would work it with the district, be a contractual agreement.
Well, my preference always is to put kids on a bus. It's the safest spot there is. After I saw one get hit by a truck, I'd rather have them on a bus than anywhere else. Anybody else? Do you have any questions for Carrie? Thank you, Ms. Klein. Anybody else for more public comment on charter schools? Going once. Going twice. Okay, we'll close public comment. Committee, do you have any directives on charter schools? Everybody shaking their head. Okay. Now we get to move to item number 9, which is reimagining and innovating the delivery of education, or the RIDE program. We have Megan Degenfeller, Lachelle Brandt, Bill Lambert. Welcome. Who's going to start us off?
Mr. Chairman, I'll begin today. Mr. Chairman and members of the committee, I'm Lachelle Brandt, Governor Gordon's Deputy Policy Director, and we appreciate this time on your agenda. There is no ask by Wyoming's Future of Learning Partnership, but really just wanted to give you an update on all of the great work that is happening currently in districts across the state. I believe you have left the best topic for last on your agenda today. I might be a little biased, but and I am very honored to be joined by Chairman Lampert of our State Board of Education, and of course our State Superintendent of Public Instruction. So just to start with stepping back a little bit and giving you an overview of what is RIDE. As you recall, in 2021, Governor Gordon appointed the RIDE Advisory Group with a critical mission that, Mr. Chairman, you were a part of, and we thank you for your work on that. And the critical mission was to evaluate Wyoming's K-12 education system and to gather insights from those that were most closely involved in the work: students, parents, educators, and employers. And the goal was clear, and that was to really position Wyoming as a national leader in education. So to achieve this, the group conducted a comprehensive statewide survey, which you've heard about on several occasions, that engaged over 7,000 respondents, and we held 17 community listening sessions across the state. This extensive effort culminated in December of 2022 when the advisory group presented their final recommendations to the governor, and there were really 4 key areas that rose to the top. The first one was competency-based learning, prioritizing the integration of life skills and competencies into education while reevaluating our standards and assessments. The second one was our career pathways, expanding opportunities for K-12 students to explore and develop skills essential for high-wage, high-demand careers. And then post-graduation success, including ensuring that students graduate with a strong foundation to their education that prepares them for success in their future endeavors. And then lastly, mental health and well-being, strengthening the role of schools, communities, and supporting the mental health and well-being of both students and educators. These are all priorities, many of which have been discussed here today and are central to the ongoing efforts to elevate Wyoming's education system. While the RIDE Advisory Group was conducting its work, the state board was simultaneously laying the foundation for student-centered learning, and that was by developing what you're probably familiar with, our profile of a graduate, and then also refining our state standards. And Chairman Lampert will provide more details on this shortly, so I won't steal his thunder, but I will say that these 2 initiatives have been highly complementary of one another and work in concert to advance our shared goals. And then in 2023, our state superintendent took office. Superintendent Degenfelder, after she began, we formed Wyoming's Future of Learning Initiative and Partnership, and that was to begin developing the recommendations from RIDE and the profile of a graduate. And with that, Mr. Chairman, I'll turn it over to Superintendent Degenfelder to discuss how our partnership was established and how it's evolving and aligns with her strategic plan.
Thank you, Mr. Chairman and committee. Again, Megan Degenfelder. As Ms. Brandt said, what this really came about as the culmination of all of these different initiatives and work of different authorities in education. So along with the governor's RIDE work, I also spent over a year campaigning, talking to folks around the state of what they want to see in their education system. And then, of course, as was mentioned, the state board was working very hard at completing their profile of a graduate. And then we also had the University of Wyoming in their Master Educator Competency Program, really on the same page. And so what was really great about this partnership was recognizing we all have in this area of student-centered learning, we'll talk more about the competency-based learning in particular, we were all aligned on that goal. And so we could all go about it alone, but we wouldn't be successful knowing all the different checks and balances that are in education. And so to be successful, we created initially a partnership of those 4 entities, but then later, the following year in 2024, recognized that we also need to have our district superintendents on board as well as the Community College Commission. And so they have joined that effort as well. And so just briefly how it aligns very well to my strategic plan, in addition to the governor's RIDE work. My second initiative is all around preparing students for jobs through CTE with goals of increasing workforce credentials, work-based learning, as well as competency-based learning, soft skills, and student success plans. So a lot of alignment. What I heard was the same thing that the governor heard in the RIDE sessions. And then I'll go ahead and pass to Chairman Lambert because they also heard much of the same in their endeavors with Profile of a Graduate.
Thanks, Mr. Chairman, members of the committee. You know, today I sit in front of you being the chairman of what I always like to remind people of, Citizens Board. And we're made up of citizens around the state to help education. And the first thing I'd like to do is put a plug into the partnership because my tenure goes back quite a ways being on a local school board, and it's one of the first times I think a group has come together and really worked together for education. And so I hope that can be with your help too as we move forward with some of these things. The profile was a vision of the board back in 2021. We talked about it a little bit in 2020, and then we really got on board in 2021. And we took it out to the public. I mean, we had this idea, this vision. We took it to the public. You know, we went to students, parents, industry, business owners, anyone that would contribute to any of these sessions, we listened to. So we brought all that information back. We put all these things together, and we tried to really capture what we heard of what people wanted out of a Wyoming high school graduate. But then we took it back out to the public again and went through some more listening sessions just to really ask the question, did we get what you want for a graduate? And we had some more comments, but for the most part, those were all positive that we had captured that. So now that is the profile that you all have seen and you're seeing today is what really the Wyoming people have come together and really said they want for a high school graduate. So as we were working on this, I mean, it's interesting because the governor had his RIDE program, and which, you know, a lot of the things the governor heard through all that process really tied together with a profile. And then Superintendent Degenfelder, when she was on the campaign trail, it really, all three of these things tied together so nicely. So we hope, and I guess there's already proof that education in Wyoming is really using the profile as what we call their North Star. I mean, everything that we're trying to do is get kids to have the skills that are listed on that profile. And so even the academic standards, as the department is working with these different committees on the 10 content areas for the standards, they're trying to use that for the North Star and say, are these academic standards getting kids to where they have these fundamental things that Wyoming people have said are important? And a lot of the districts are doing this well. I mean, I think the RIDE districts are probably a little ahead, but I know the other districts are really using that and trying to use this for their North Star with everything they do. Now, you know, the board's in the process of getting some informal comments on revising the Chapter 31, the Wyoming graduation standards, to add these competencies as, in fact, I had to cross it out because I see I made a mistake in my thoughts because I called them graduation standards, but I think a lot of it is graduation requirements, maybe more, and trying not to, you know, interline the standards and the requirements. So that's still in process, but with that, I guess I didn't follow. I did believe it's back to Megan. Thank you, Mr. Chairman and committee members.
So, Mr. Chairman, let's talk about what the pilots look like. And they're really aimed to rethink key elements of instruction and assessment to be more student-centered. And they build on teaching practices and initiatives that are already underway in each district and support the development of local capacity to sustain student-centered transformations. So the work does look a little different in each district, and you'll hear from 2 out of the 9 districts from the first cohort in just a few minutes, but it's not aimed to add more to teachers' plates, but to really come in and provide additional supports to some of the work they're doing and bolster those efforts. So in year 1, we had 9 districts. We had Converse 1, Lincoln 1, Park 6, Park 16, Weston 7, Laramie 1, Albany 1, Sweetwater 2, and Teton 1. And many of them were here with us or still are today. And frankly, if you know, I had my choice, it would be best for you to hear from all of them and probably instead of us. But if you haven't had the opportunity to join one of their local district celebrations of learning, I would encourage you to do that if you have a RIDE pilot in your community, and to engage and listen to students and teachers and the impact it's having in those districts. In cohort 2, moving into year 2, we've added 11 districts: Park 1, Platte 1, Platte 2, Weston 1, Fremont 25, Sheridan 1, 2, and 3, Johnson 1, Prairie View Charter School, and Sweetwater 1. And then if you combine those together, we have 20 now represented within the pilots, which is approximately 50% of our Wyoming students. So just to give you a quick overview of impact from year 1, like I said, 9 school districts with a 223 participants. 78% of those were teachers and 22% were leaders. Moving into year 2, we have the 20 participating districts. As I mentioned, 50% of our Wyoming students, and we're projecting a total of 600 participants. And many of the school districts, this was an opt-in for teachers. They weren't told that they had to do this work. It was volunteering. And as these have been successful, more and more educators have been interested in the work and have joined the pilots. And the superintendents can speak more in depth about that. And so before we hand it over to the superintendents in Weston 7 and Converse 1, who are the true heroes really driving this work, I'd like to show you a brief video that was created last year in May at the Celebration of Learning after the 9 pilot districts initially did their work, and I think it highlights the impacts that they're experiencing firsthand in those districts. Actually, I don't know if it helps. It's embedded on the previous slide where it says district stories. If you, yes, I apologize. If you click on the district stories, it should load. Maybe we can, oh, there it is, okay.
Dang that technology. These are like Sour Patch Kids.
This initiative, it really enlivened our teachers. Our learning just went through the roof. Our engagement is awesome. Our kids are excited. Our teachers are excited.
Showing perseverance, they're showing better attitudes towards school, they're showing kindness.
There's this autonomy
They know what their interests are. They start to see their own creativity. They start to see how they can communicate.
I'm really excited about it because this is like me actually trying something new so other students can have the same experience in a couple of years.
The RIDE initiative really came out of several different pieces of work happening across the state. You know, a recognition Governor Gordon put out a listening tour, really trying to understand what Wyoming families, communities, educators, students, businesses, really what their hopes were for education. At the same time that was happening, the state board was touring the state, doing similar listening and building out a Wyoming profile of a graduate. And the University of Wyoming was also listening across the state to build out a profile of an educator.
And what bubbled to the top was really student-centered learning and allowing students to move when ready, and providing more choice in their education.
We have this identity definitely in Douglas and also in Wyoming where we want to be people who can get things done. And performance assessment, student-centered learning matches up with that identity. We want students who can get things done, who can actually produce something of value, not just sit there, play the game of school, regurgitate something on a test, and say, look what I know.
One of the things that's really unique about this work is that there is no recipe. No one has the script of a district except that district and that community. Part of the work is really about listening and learning with districts, with their design teams, with their educators, about what it is that they hope and aspire for their learners.
We've spent a lot of time over this year talking to the leadership teams in every district, saying, what are the things holding you back? Whether they're rules, whether they're regulations, or whether they're existing policies, or the absence of policies.
Really what they helped us do is define our next step, and that's identifying global skills. And how do we assess those? So now we're assessing creativity. We knew kids are creative in our system because it just naturally happens. But we didn't assess that, and we didn't make kids self-aware of that.
I can teach skills. That's not hard to do. But what is hard to do is teach somebody how to be a problem solver, right? And how to have confidence in presenting ideas and trying new things and have confidence in their failures. Like, that's a really important skill for people to have, is to be okay with things not going right. RIDE really helped kind of support that process for me, where I started to think about, like, yeah, this isn't about getting 100% on a test. It's really showing me what you can do and what kind of person you are.
Kids question everything we learn. Why are we doing this? Well, is that going to make a difference? And the answer is, at the end of the day, yes. And I think we'd have a good example of showing them how, why, and when, and where.
From the teacher to the student observation point of view, it's a little scary, right? It's new ground, it's ambiguous, it's uncomfortable. But that's right, that's the magic. That's where the learning takes place, is when we stretch these kids and take them to places they've never been, but we know that they are so ready to go. And that's what's exciting. And to be able to interact with them through that process and learn alongside them, because you're learning it too, right? And I'm growing as a teacher and they're growing as students, and it's really exciting.
I was able to see engagement and motivation. And as the 6 weeks went on, they were kind of like, are we having science today? You know, do we get to have science today? When do we get to have science? So I naturally became the facilitator of their learning instead of this direct instruction teacher that was just throwing knowledge at them. You know, they became the instructors in my classroom of what they wanted to learn and how that looked.
Our parents have come and said, hey, tell us about this bug project. Tell us about this thing my kid's working on with the guidance counselor. And so it's opened up more authentic conversations about the learning.
Many schools are already doing great things, and this isn't a you do your great things or you do the right initiative. This is an and situation. You can do your great things and you can do the right initiative. And really, it's just going to help you hone and refine skills that you're probably already practicing.
So if you're an administrator and you know that you have a teacher that they're in on this,
Like if they are the new cutting edge, want to try the new thing, there's their license to go. Let them create and just support them. If you're a teacher, it's, you know, what is the hallway conversation that you've had? Because we've all had them. Every one of us in the profession just stood there and said, man, wouldn't it be cool if, well, you're allowed to do that if you want that opportunity for your kids, if you want students to be able to explore, right, you know, dig into their passions, learn through more hands-on means. I mean, whatever you want it to be, this is your license to do that.
It's refreshing to see where the state's headed. It's refreshing to hear the stories of these schools moving in this direction. It's refreshing to feel the energy of the speakers that were up there, and then the energy in the crowd about, you know, what's possible. And if the state's moving in that direction, I just can't imagine where our education system will be in, you know, 10, 20 years.
Mr. Chairman, if I could turn it over to Superintendent Coberly and then Superintendent Fenton Hughes to give you a brief overview of the work in their district.
Very good. Let's do it.
Absolutely.
Welcome.
Thank you, Mr. Chairman and committee. Appreciate the opportunity to share our story with you. My name is Clark Coberly. I'm the superintendent of Weston County School District 7 in Upton. And just to tell you a little bit about what the RIDE work looks like in our district. RIDE in our district looks a little bit different than the other districts that participated as we began our journey towards a personalized learning model of instruction about 8 years ago under the guidance of my predecessor, Dr. Summer Stevens, and Dr. Linda Crawford, who was the Upton High School principal at the time. The current model we use today really started to take shape more robustly about 2018, though. We collaborated with a consultant group district-wide to grow our competency in a personalized learning model of instruction. I attended, also during this process, I attended the listening sessions in Gillette with my school board after we had kind of been flying the plane while we've been building it with the personalized learning model. When the opportunity arose to become a pilot district, we knew we had to be involved because of the work that we had already been doing. The work was, we had been speaking that language in the community of Upton for some time. And at this time, Upton High School is the most established in our district using this model. Upton Middle School is emerging more. And Upton Elementary continues to integrate personalized learning strategies every year based on some of the work that we had done when I took over as superintendent in 2018. We continue to be a work in progress and continue to seek ways to be best effectively meet the needs of our learners, young and old, the students and the staff in our district. The main focus of our efforts last year with the RIDE program, last year we concluded with enhancing student voice in our coursework at the middle school level so that they would be better prepared for what was happening and being able to take on the model that they were going to see at the high school. One of the things that we did, a big focus was the student-centered approach in the classroom, but they were leading the last parent-teacher conferences that we did in March. We initiated student-led conferences, so they were able to talk about their full body of work to their parents and go deep into their learning. This allowed the students the opportunity to demonstrate greater learner agency as they communicated to their parents the work they did and the learning that they did just beyond the grade that they were getting or how they were doing in the class. They were able to define their learning at a better level. At the high school, teachers began to create rubrics that reflected student outcomes tied to the competencies of the Wyoming profile of a graduate that was on display and that Chairman Lambert visited with you about. The focus were the competencies at the bottom of the profile of a graduate. We chose to only bite off 2 of those last year, the competencies of communication and creativity. And to focus on creativity, it's because it supported critical thinking and solving complex problems. So what we're trying to do there is we're trying to tie our learning at Upton High School towards the outcomes that are communicated on the profile of a graduate. Beyond the test score, beyond what's going on in the classroom, how can we demonstrate that we're effective communicators, we're effective problem solvers, and the other components. I'm not going to go into all the competencies tonight. Work this year is already starting to build off the 2 areas of focus from last year, building greater learner agency. But what we want to do is we want to make sure that our learners, our lead learners in the classroom, or teachers, are better at assessment, grading, and communicating learning outcomes to the students and parents. Beyond, eventually we want to get to redefining what our transcript looks like in Weston 7. This work with the assessment and grading growth that we're going to be doing with our staff will take place K through 12 in our district. What are we seeing right now in terms of impact? We're seeing a greater connection between how we have operated in the high school for the last few years and how we're able to do that at the middle school and at the elementary level as we build that foundation. We've also increased learner agency with middle and high school learners. And when I throw that term around, learner agency, what we're talking about is the students have greater levels of voice, choice in their learning. We're seeing greater student engagement, greater student motivation, greater ownership in the work that they do, a greater sense of purpose in the work that they're doing in their courses, and greater self-efficacy with the students. They're able to advocate for themselves as they understand the learning and why they're doing what they're doing and preparing themselves for the rest of their lives. One story I want to tell, last year when we did our accreditation visit, our peer review visit through the Wyoming Department of Education, that we cut the team loose. They go to the students and you just don't know what they're going to be talking to the students about. They're asking about the learning. The chair of our peer review team came back and he said, I don't know the name of the student, but one of your students was able to talk to me not about what they were doing, but in the classroom, but at a greater depth than they had ever heard. And this is a lifelong educator in the state. And he said they were able to define the standard, but talk about how they were able to illustrate the mastery of those standards and articulate it in a way that they had not seen before. That's just one snapshot. Personalized learning in our district elevates the level of engagement and relevancy. Also, the student-centered approach puts families in control of their child's education as we talk about what the student's interest is to give them flexible pathways. All students at Upton High School, our goal is they will graduate either college, career, or military ready. And we work with them, we develop relationships with them so that we can make sure that they're on that track so that they can push forward on those outcomes. What does it look like moving forward? We want to just continue to provide clarity of what our message is to our stakeholders in the family, be a model to the state, so that they feel confident and other districts have the competency to, again, we got 48 districts doing things in a great way. We're just doing something a little bit differently to serve a small community that we don't always have the staff. We use the flexibility of the block grant like you would not believe to be able to make that work and be able to execute what we need to do. And at the end of the day, as a small district, the sentiment that we feel in Upton is we want a small district. As a small district, and I have a few colleagues behind me that also represent small districts, but specifically in Upton, we want our graduates to have an advantage in the world rather than a disadvantage because they come from a small school. And I think that's something that everybody up here firmly believes. For students throughout the state of Wyoming, we want them to have an advantage in the world as well moving forward. So with that, I'll stand for questions or I'll get out of the way for Superintendent Fenton Hughes. So,
questions for Mr. Cloverly? Thank you, sir. Good job.
You're welcome. Thank you.
Mr. Chairman, Paige Fenton Hughes, Superintendent at Douglas. And I'll just share a few remarks about what the RIDE initiative has looked like in our district. And I think you'll be able to tell from Clark's story that each one of us was able to chart our own path and to tie the work into what was already happening in our district. So it looks unique for all of us. But under the leadership of our principal, Wes Gamble, who, by the way, is one of the best defensive coordinators in the state, just saying. Converse One began with only 4 core teachers at our intermediate elementary school, and that's grades 2 and 3 for us, along with a design team of 13 people, and that included administrators, instructional coaches, and our special services and support staff. We also sent all of our CTE staff down here to Casper to the RIDE kickoff celebration so that they could learn more about the opportunities that the RIDE initiative offered. In February, we expanded the RIDE initiative to all of our special staff, which includes CTE, STEM and computer science, art, music, PE and health, and foreign language teachers, along with all of our math teachers and our entire social science department. So that was just under 75 instructors. The focus of their work has been around creating quality performance assessments. And administratively, we've attended the statewide webinars that were offered to all of us on innovative approaches to learning. And we also worked with our colleagues of Two Revolutions, who are experts in school finance, to examine our resource allocation plan and ensure that that resource allocation plan is closely aligned to our roadmap of excellence, which is our strategic plan. They provided support in rethinking the design of that document to make sure that it was user-friendly and that our board's guidance to us about budgeting was made more clear. As part of our district assessment system and our instructional cycle, the main focus of our work has been, as I said, on creating and deploying quality performance assessments. So our teachers have done this work with the support and guidance of the Two Revolutions team, that district design team that I mentioned, and our cadre of instructional coaches in our district. So the impacts that we have seen as a result of developing and deploying these quality performance assessments include honoring student voice and choice, and I think you heard that from Clark as well, regarding how they demonstrate their learning. So they can choose some different ways to show what they've learned other than traditional testing. More rigorous and less typical assessments. So some of our students remarked that it didn't even really feel like a test, like they were doing a project or performing or showing their work. And like you saw Evan in that video, they were demonstrating something that they can apply in a different situation. We had a lot of cross-curricular collaboration and reinforcement of multiple state standards. So teachers are thinking together differently and they're working together more effectively. So at our elementary school, a unit that was taught in 2nd grade was then reinforced in art, reinforced in STEM computers, reinforced in PE health. And so all of those teachers, that 2nd grade PLC and our 3rd grade PLC, those were working with that team of specials teachers so that that work was being reinforced across all of those areas and hitting a bunch of standards in there, not just, one math standard, for instance. Beyond content, there's been much more focus on the elements of the Wyoming profile of a graduate. And if you'll notice, what we've traditionally thought of as schooling is one column in there. The other 3 are something else. So good work on that, Bill, by the way. And then we've had a lot of engaging and challenging instructional shifts. So when our teachers started designing one of these performance assessments, I was sitting in there And one of them said, well, she said, we're going to give this test differently, but we're going to teach the same unit. Guess what? They didn't teach the same unit because you can't teach the same to get there. So those shifts happened because of the shift in the assessment. It allows us to envision what the profile of a graduate looks like in action. And although we have a number of things going on in the district, so we can't really isolate a cause effect to this one thing, our proficiency scores went up. So I'm not going to complain about that for sure. Moving forward, we're taking a two-pronged approach based on the differing needs of our staff. So one group will expand and build on the base of building quality performance assessments tied to the new pared down standard sets, which are also very nice, and adjusting instructions so that students can succeed on these assessments that they're building. And the other group, which is mostly these specialist teachers, are going to be doing deeper learning around student-driven assessment because they do a lot of performance assessment already. If you're a band teacher, right, or you're the CTE people, so they're going to be doing a little bit different work. We're also drawing on Two Revolutions support to rethink our daily schedules and how we deploy our staff to better meet the needs of students at the intermediate school. So we'll be embarking on that work in 2 days in September and October, building on our work from last year. So we want to thank Lachelle and the governor's office, the University of Wyoming, the department, and Superintendent Degenfelder, and for sure our support team at Two Revolutions, because they've been with us every step of the way and have adjusted their support throughout the year. So it's been a great opportunity. We had Lachelle, we had Bill, we had Dr. Buss from the university. Diana's been in our district at our Celebration of Learning, and also at Riverton for the statewide Celebration of Learning, where our teachers and our students got to showcase their work, and it was pretty fun. And I think you saw in there everyone clapping. It was a fun day. We want to thank all of you for being interested in this and hanging out, Mr. Chair, till 5:19 to hear us talk about it. And we hope that you continue to support innovative ways to move education forward in our state. And finally, I want to thank my brave colleagues who are out here, Gillian is, and Shane and Clark. And we were part of a group ourselves where we would meet, work together, and kind of support each other. And I want to thank them for that. So I just want to say in closing, Mr. Chair, that if we want to have an education system in Wyoming that's responsive to today's students, which are much different than us, and different even than my son, who's only 20, and one that's embodied in the profile of a graduate, let's continue to work and build on this good base and re-envision maybe accountability and change the rhetoric around that. Because an effective education of the future isn't going to look like any of our past. And it's not even going to really look like what we're doing now. So much like Weston 7, our vision in our district is that everyone graduates life ready, so it's close to his, but we need to rise to the occasion to ensure it's possible for all our kids. So thank you guys for your support.
Thank you.
Mr. Chairman.
Go ahead, Chairman Scott.
Question on the timing of things for you. When did you start with these ride innovations, and when did it penetrate far enough into the schools so it was really affecting the education that we ought to be able to start seeing objective results out of it?
Mm-hmm.
Go ahead, Paige.
Mr. Chairman and Chairman Scott, so I can tell you the timeline. Your last question is a little bit harder, but so I think we started knowing way last spring that we could apply. So like in the spring of 2023, help me, Lachelle, with my years. And so we talked about it in our districts, and then Lachelle reached out to districts and said, hey, we want you to be a part of that. We applied in June, and then it was kind of a process to get accepted. And we had the support plan in place by August. So at the beginning of last year, we put those teams together that I told you about. And then they were already starting to do the learning around performance assessments in the fall of last year. They deployed them by December and January, and they were assessing kids and getting results back by February of last year. And we did our celebration of learning, I think February 9th, somewhere right around there. So like I said, Chairman Scott, we can't really isolate those test scores to this one thing, but I'm going to tell you it didn't hurt, right? It's one of many things that we're doing to help our kids learn in different ways and be more engaged in the learning. I think over time, we will be able so now we're going to go a little bit deeper, and we will be able to gather data on certain assessments now, because all of those teachers in that cohort, which is like 75 of them, will be deploying these kinds of assessments. So we'll be able to see what the effect is for sure. Say you're going to assess these standards a year ago. Now I'm going to give a different kind of assessment this year. We can have comparative results on that by the time they deploy in this school year. I think what you were asking me is, how soon will we know if our Y-top scores go up and stay there? Because I know you pretty well. I don't know. I don't know the answer to that. I hope soon.
Go ahead. Senator Beitman.
Thank you, Mr. Chairman. I'll follow up on what Senator Scott was asking. I was thinking about this in a different way. First question is, are these assessments all using standards-based grading, like 1 through 4? That's question number one. And then number two would be, the follow-up would be, have you taken assessments that don't use that type of grading and they're more standardized, and to see if your results have gone up? Because sometimes I feel standards-based grading is very subjective. I've had some of my kids as teachers that don't give out 4s no matter what. Some hand them out like candy. So, but your thoughts on that?
Mr. Chairman, yeah, and Senator Beitman. So we use standards reference grading, and we don't use it the same in all of our schools. So our high school's much different, and they get much more traditional kind of grading looks. They're not all 1 through 4, some are. So I would say the answer to your question is, it looks a little bit different all the way. And those teachers I was telling you are in all of our schools. So like our primary school, that grading is much different than, say, our middle school and that kind of thing. All of it's standard aligned though. And then will we be able to gauge that? I think the way I was answering Senator Scott's question is true. We will be able to gauge improvement year to year on the same standards using different assessments. I think that will. And hopefully we'll see it just through this engagement. Our kids are more engaged, our teachers are more engaged, that will just be learning across the board that gets measured in multiple ways. But maybe I'll be back here next year answering your question better and with better data. But we will be gathering it because these guys are going to ask us for it and hold us accountable for the support they're giving us. So we'll be bringing you something. And just so you know, Mr. Chair, when it comes to bringing the data, I won't be the girl. It'll be my assistant Soup who does that work for us. So.
Further questions? Thank you, Paige.
Yep. Thank you, guys.
So, Mr. Chairman, you heard of some of the impacts in those local districts. Just to talk a little bit about broadly across Wyoming, some of the impact that the RIDE Student Centered Learning pilots are having. I think we're facing similar challenges in some districts as we are in the nation for teacher recruitment and retention. And in this first year of RIDE, I think we've seen a lot of positive impacts. And I know from attending the celebrations, I heard teachers reporting significant growth in their knowledge, skills, and just their mindsets to support student-centered learning with high levels of satisfaction, which is really important when we're trying to retain our teachers in the workforce. Some of the key takeaways that have been expressed is that from educators is empowering students through choice, as you've heard, to demonstrate knowledge and enhance engagement. I heard that broadly across all districts. The use of learning progressions and rubrics, which set clear criteria, as you've heard, and milestones in learning for students. Collaboration and teamwork to improve teaching practices. And then feedback and formative assessment, which is essentially ongoing assessments and feedback to support student learning and growth. And then going to the metrics and the questions that Senator Scott and Senator Beitman just asked, we are creating essentially a report card from districts for these pilots. And so we will be looking at how is this affecting our YTOP, ACT, and then those locally identified assessments that you heard about. So it will be both, not replacing one or the other. And then just looking at how is this growing our educators, the percentage of them involved in the increase in districts. And then lastly, how are we growing our system? And so we'll be looking at the barriers that are identified to removing those in student-centered learning. And then I will turn it over to Superintendent to talk about next steps and some of the work that the Department of Education is leading for the pilots, and then a new initiative that she is planning to launch here in the near future.
Thank you, Mr. Chairman. So, in this discussion, you heard from a couple of districts. This is really exciting, innovative, looking out, how students move at their own pace, how they have more individualized ways to show those competencies. But what we heard a lot in districts wanting to jump on board with this was still that concern of, this is great, we're ready to innovate, but are you going to keep the same accountability assessment system? Because unless we change the system in which they're held accountable, then this doesn't really have the results that we want. And so we started to recognize that this is really new territory. It's new across the country, looking at things this way. And so, to also answer more on Senator Scott, on Senator Beitman, are those skills, if you're able to demonstrate them in a different way, are they transferable to a standardized test? These are all things that we have to explore and see how that impacts our accountability system. And so we came together as partners in the partnership and really saw this need to create a subcommittee to address what some of those roadblocks are and to visit with the districts that have piloted what were the challenges and how do we overcome them. And so those are going to look different in regards to just rules and regulations, state policy, federal policy. We're really identifying all of those. So this past spring, we brought together that advisory committee that has membership from each partner within the Future of Learning. And that work is ongoing. They were tasked with identifying all of those roadblocks in student-centered learning. And so right now we're actively going through 18 action items and developing consensus of what those changes need to be. Some of them are as simple as better guidance from the WDE that districts know they can do these things. Others might involve changes to statute. We don't have all of those at this point yet. That's why there's no ask today, but recognizing that we are looking at what those changes can and need to be. And that committee is doing a lot of good work right now. Lastly, I'll touch on the next pilot project that this partnership is going to be launching. There's, as we saw earlier in the presentation, student-centered learning can look like a lot of different things. Competency-based, and the RIDE pilot is one aspect. But we're going to be launching soon is project-based learning pilots. And so this will all be about students learning their standards, but on a particular project, ideally in partnership with a business or or community organization in their community so that they are applying their learning to real life situations and problems that they would be solving in their future careers in life. And so the other exciting thing about these pilots is we have several districts that are doing the RIDE pilots, but also going to be interested in this pilot. They're not mutually exclusive. Really, this work goes together because it's all about this student-centered learning. It's different ways to get there. And I think all of us as partners, we really wanted districts to have autonomy, that local control to develop what this looks like, but under this same goal of student-centered, project-based, competency-based learning that we're talking about. So a lot of really exciting work. I think that we are better aligned than maybe we ever have been in these efforts. A partnership like this is hard, especially when you have multiple elected officials, board appointees. And so we work through all of those obstacles as they come because we're all aligned with the same goal. And I think that's what makes it really exciting that we can partner in that way. So with that, I would pass on to Chairman Lambert with any remaining comments or Ms. Brandt.
Appreciate your time and attention, Mr. Chairman and committee, and we'll stand for any questions.
Questions from the committee? Comments? Good. Representative Clausen.
Thank you, Mr. Chair. Thank you for the presentation. And Mr. Lambert, can you give us any idea of the work that's been done on decreasing the standards so far?
Go ahead, Mr. Lambert.
Thanks, Mr. Chairman. Representative Clausen. And your question was the reduction in standards, is that where you're at? Okay. I don't have the percentages, but I know a lot of them we've cut by about 50% in the 6 content areas that we just approved. I'm looking for Megan to make sure, I'm on the right track, sorry. It's been quite a process, and now we're starting the ELA is in the process now of looking at those, and that the goal will be to reduce them too. And really when I say reduce, from the state board side, I don't want the public to ever think that we're lowering what we expect. We're just really trying to pick out the big rocks, and then districts have to figure out how to get there. So please don't take me wrong. I wouldn't want the public to think when we talk about lowering standards that we're really lowering them. We're lowering the number of standards and trying to pick out the most important things.
Go ahead.
Mr. Chairman, Representative, that kind of dovetails too into, I think, the last piece of this, if there's no other questions on the partnership work, that there's a lot of this going on that really complements each other and the assessment reduction plan with that as well. And so I'm happy to go into that if that makes sense.
Do you want to ask a question or let the superintendent continue? All right, go ahead. Representative Lawley.
Thank you, Mr. Chairman. I want to go back to your project-based learning pilots. Are all districts eligible for that, to apply for it? Is that how you're doing that process? How are you selecting? I know I had some districts that wish they had been in the RIDE. So I don't know how you're making that. Are you going to give preference to those that were in the RIDE pilots, or what's your thoughts on that?
Go ahead, please.
Mr. Chairman, Representative, I believe that, so we had to start rolling out, we're using some remaining ESSER funds in order to do that, but it has been available to those districts. I'll look to my colleagues if any.
That's correct. They had the opportunity to apply, so for the project base, it was any district that wanted to apply to that.
Any more questions? Madam Superintendent, would you like to continue with your discussion that you had?
Yes, thank you, Mr. Chairman. So this really dovetails off of that discussion of prioritizing or reducing standards, as the state board has worked so tirelessly and along with my staff to do, which it has gone a long way with our educators and with our education system. And so another piece of this that is a bit separate from the pilots, but again, a lot of this really works well together, was what we brought to the state board, an assessment reduction and efficiency plan. And so we presented this to the state board because, as we know with our assessment system, it's really a collaboration between the state superintendent and the State Board of Education. And so wanted to just take a quick moment today to update you on that plan that was presented to the board, and then the work that we've done collaboratively with the board and moving forward on some of those recommendations. So there's a few pieces of the plan. The first was to reduce the length of math assessments. This has been approved through the blueprint with the state board at their last meeting. And so in grades 3 through 8, we will be seeing a decrease of around 30% of the number of items on that assessment. So that has been approved through the state board. The second was to remove kindergarten, grades 1 and 2 interim assessments. This was an administrative decision we were able to make through the agency, and so that is effective for the next, this school year. Third is removal of grade 3 writing. This was also approved by the state board at their last meeting. And then the other two are really, we're going to begin exploring with a subcommittee within the state board and the WDE, looking at how we evaluate grade 9 possibly from required to optional. When you look at the requirements of the federal government and what we do at the state level, there really isn't a lot more that we require at the state level. But one area is that we do have an additional assessment in the high school level. And so thus, the discussion around should we remove grade 9 or 10 in that discussion. I think there's still a lot more discussion to be had with districts on that. And so we'll be doing that. That would require a change by the legislature. And so again, we're not here today with any requests, so we haven't fully vetted all of that, but we'll be looking at that. Reformatting the high school math assessments. This has been partially approved as well through our assessment blueprint with the state board. Really moving from those specific math subject areas to comprehensive math skills. As we move into competency-based learning, we heard a lot from folks that a student maybe took that math class a year ago or 2 years ago and are now being expected to be assessed on that. And are we setting them up for success in that way? Should we be assessing more on these comprehensive math skills? And then lastly, developing more diagnostic tools for parents and teachers to really break down the YTOP assessment to better understand data and progress by student. And so we recently went under contract with a vendor that is really going to be creating a database to do that. And we already have a considerable number of districts that are on board with that. And I should state with all of this plan as well, the way in which I went about it was to set up meetings with different stakeholder groups. We met with the Superintendent's Association, we met with the assessment directors, we met with the the teacher level up groups, really trying to get as much input, both of the principal associations, to get as much input as possible in what they wanted, because we heard loud and clear, I heard loud and clear throughout the campaign, legislature has spoken about it, of this need to reduce our standardized testing. And so this is a way of doing that, finding where we do require additional requirements on top of those at the federal level. And so this is truly a plan that was created by the voices of people in Wyoming education, what they wanted. And so we completed this, brought it to the state board, and we're starting to take action on each of those. So with that, Mr. Chairman, I went through that very quickly because I know that it's a late hour, but happy to take any questions.
Chairman Scott, do you have a question, comment?
Yes. Chairman, question, what assessments are you talking about? And I'm trying to figure out which ones they are, because I'm just not clear when you say assessments, which ones are you talking about?
Mr. Chairman, Mr. Co-Chair, the state assessment, the YTOP assessments.
Mr. Chairman, I'm appalled that this is going on. I'm very concerned about, does this mean that when we look at the next YTOPs, we won't be able to say they mean the same thing as the previous ones? Is it basically a new YTOP test because you've removed parts of it and removed the comparability?
Mr. Chairman, Mr. Co-Chair, I don't know that I would say that. I think we're also aligning, it's new in very different ways because of our standards as well, that prioritization and reduction of standards. And so it's going to look different in that sense, but we have not changed any of the standards that are being assessed. It's the sheer number of items that will be assessed by the students. So it's still the same standards being assessed.
Mr. Chairman,
Go ahead.
if you remove the third grade writing portion from the English language arts, does that mean that if we look at English language arts from this last year and from the next one after it's been removed, that they aren't comparable and we don't know what the new one means compared to the old one?
Mr. Chairman, Mr. Co-Chair, it will not include the writing component of that. Now, if you look, we've looked through the data of, because we also don't assess writing every year as well. That's important to recognize. And so this is only eliminating in grade 3. Grade 5 will still contain the writing component.
And so you're hoping that by assessing on grade 5, you'll be able to pick up whether or not we're working in grade 3.
Mr. Chairman, that's correct. And when you speak with the teachers, the writing ability of children is not going away. What we heard loud and clear on this was that children at this age are not prepared to take that writing test because it's become more of a keyboarding exercise than it is actually showing their development in writing. Grade 5, on the other hand, they felt was appropriate. This also, I would add, is above and beyond what the federal requirements are. And so that was the ability to remove that at the third grade level.
Mr. Chairman, I am deeply concerned that this is an effort to obscure what's really going on out there and will have that effect. So I will take the subject up later on.
Mr. Chairman.
Because I am, if we're going to be able to measure what's going on, which is what we have to do in order to manage it, we can't change the measurement all the time. That's been the history. We've changed them every 5-6 years. And about the time we learn what the old assessment meant, they change it and you can't figure it out for a while again. It takes a while to learn what the new one means. And so I'm deeply concerned here.
Mr. Chairman. Thank you, Mr. Chairman. I would just say that that's not the intent at all. I believe very much in a strong accountability system. I think that the worst thing that we can do is move away from that. I think that there's ways this is really about efficiency in testing and reducing the testing time that students are exposed to. We heard this loud and clear from parents, from students, from teachers, that the testing burden was too much. And so this is the way that we're going about it while keeping a robust accountability system.
Mr. Chairman.
Go ahead, Senator Brightman.
Thank you, Mr. Chairman. My question is about a couple different things. First, the Y-top, let's take that. So when my kids take the Y-top, it's a big production at school. Everybody's freaking out about the Y-top and then, make sure your kid gets all this sleep and they're testing like crazy and then it's over. But we never get the results. As a parent, the results don't come in the mail. I don't know how my kid did. I don't see what percentile compared to other kids around the country. When I was a kid, we took the Iowa test, and I knew exactly where I was every year on math, reading, science, you name it. I knew if I've gone up or down. My parents knew, everybody knew. Why is it so hidden with the Y-top? Why isn't that data given to the parents? That's question number one. And my other concern, again, is about the standards-based grading, especially at once you get to junior high and above. Are we going to start getting away from that? Because I hear from my constituents that are very frustrated with how subjective it is. And the fact that you can't really have an honor roll in a junior high when everybody's getting 1 through 4s, and how do you convert that to a 4.0 grading system? And it's convoluted. The parents don't understand it. The kids don't understand it. And it doesn't feel like it really rewards academic achievement like it used to. So 2 questions, one about the Y-top, 2 about the grading system and the obsession with being standards-based instead of just, did you get it right or wrong? And did you get 9 out of 10, 10 out of 10 on a test? Because I don't think our proficiency correlates to standardized tests very well. I think we got all these kids proficient, but then they go take a standardized test and they bomb it because they really don't know it. Your thoughts?
Go ahead, Sue.
Mr. Chairman, Senator, so I certainly can't speak to the district on how they're disseminating anything with YTOP. At the state level, this last year, we did try to create more tools for parents for understanding that at the school level, because it was really just prior, just really state level even. And so trying to make sure that parents can really dig into that. These new diagnostic tools are meant to do just that, because we heard from parents, from teachers, this YTOP data is not helpful to us. It's not informing our instruction in any way. And so we need to be able to better understand it, the progress of individual students, breaking it down that way. And so that's really exactly what the goal is. In reference to your example with grading, I would just say that that's really a district by district decision. And so I think it varies from district of what they're doing. And so I probably can't speak too much to that of what your particular district is, but I would say that that is absolutely a school board discussion that should be had if there's concerns.
Further questions for the superintendent? Thank you for presenting. All right, committee, that concludes all of today's agenda.
Mr. Chairman, did you want to take public comment on this item?
I was so close. I was so close.
I'm
Okay.
sorry, we had somebody online who would like to provide public comment.
That'd be great. Have them please present.
Okay.
Anybody in the audience like to comment publicly? We have a little time. You know how technology is.
She is joining the room now.
Hi, and welcome to Joint Education.
Good evening, Mr. Chairman. Can you hear me okay?
Yes.
Good evening. My name is Emily Parvasini, and I am speaking to you today as a Sublette County parent, also a 93 graduate of Pinedale High School. I currently have a 5th grader enrolled in Pinedale Elementary School, and I have 2 older children who graduated from Pinedale High School in 2020 and 2021. They were also students, grades 1 through 12 through District 1, Sublette County. When my older kids were in elementary school, it was a much different education than it is now. They were required to do handwriting, they did spelling tests, they did a lot more hands-on actual learning than my 5th grader is doing now, and they excelled, at least until middle school and high school, when computers became part of their everyday daily curriculum. My current 5th grader doesn't do spelling, and she hasn't since 2nd grade. She doesn't do handwriting, and it shows. Her handwriting skills are absolutely atrocious. She isn't learning the principles of cursive, and the students haven't for years. She's still struggling with multiplication and times tables because they no longer require that they memorize them. We've been working on these items all at home for the last couple of years, but her class as a whole, the 5th grade class, and there's 4 of them in Pinedale Elementary, I feel is behind where they should be when I think about where my big kids were when they were in 5th grade. These kids were all kindergartners when COVID happened and missed their last half of kindergarten, and then 1st grade was entirely math. They don't need spelling, is what I was told, because they have spell check and autocorrect. They still need to know the difference between there, and there. What's the difference? Laptops and iPads in the classrooms for elementary school kids. Kids don't learn, especially elementary school kids, effectively from electronic devices. Electronic devices have no place in the elementary school setting, and they should be limited in the high school and middle schools as well. I feel kids all over the state are behind where they should be, and schools say that it's because they need more money, and I disagree. I believe it's truly because there aren't enough textbooks, paper, and pencil being used anymore. I hear about kids writing term papers and applications for scholarships using ChatGPT. Our libraries here in Pinedale, in both the middle school and the elementary school, have hardly any books in them. Kids practice their math using math games on iPads, which are fun, but they're not effective. I mean, I think about and I think we can probably all agree that tech has had more negative effects on the mental health of our students around the country. I sent an email that shows 1/4 period, one teacher paid attention during the 4th period, and I think she's handing that out right now. And she had them turn on their phones, because they all have a phone in their pocket. A teacher in the US had her students turn their phones on loud, and every time they received a notification, they went up and put a tally mark under the correct category. This is one class, one period. Every single one of those tally marks is an interruption in a student's education. And I realize that cell phones are not really allowed in the classrooms, but these kids have figured out that they don't need their phones to text each other when they can email each other back and forth. And literally some kids will email 200 and 300 times a day to each other. And it pops up on their computer every time they're sitting there in their class, and it's constant interruption. When I talked to my superintendent at our Pinedale school, elementary school principal and the vice principal about the problems that I see with my kid and the kids that are in the same grade. A lot of these are my personal friends, and we all kind of feel the same. And all of us say the same thing. Bring back classical education. Bring back paper and books, writing and spelling, and reduce computer use in the classroom, and eliminate it, please, completely from the elementary classroom. It's inappropriate for kids to learn that way, and it's ineffective. We want to be efficient, but we don't want to be so efficient that we forget to actually teach these kids. The response that I got was that the state and federal levels mandate what goes on in the classroom, and that they are the reason that computers are used so heavily, and that there was nothing that anybody can do about it. Well, they talk about parents having a stake in how our kids are taught and what they're taught. But then they tell us that, no, we're going to continue to use methods that are ineffective, especially for elementary grades kids. If there were other options here in Sublette County, like a charter school, I would do it. I would put my kid in that school, or a private school. So please, when we're talking about the future and reimagining Wyoming education, please consider limiting the amount of electronic interruption that's allowed and permitted in the classroom by first reimagining the classrooms are the way they used to be. They're places without iPads and without YouTube, without constant electronic interruption. Classrooms that are more of a classical education style. If we want our Wyoming students to excel, the first thing we need to do is bring back true education. Teachers need to teach. They're not doctors. They're not behaviorists, therapists, bouncers, or social moderators for the socials online. Let them teach. I love the fact that the new RIDES program allows for more hands-on, because I feel like a lot of students learn really well that way, but especially at the elementary age, we need to keep the writing, reading, arithmetic that we've always had, because when they carry over into middle school, if they can't write a paragraph by hand with a pencil from imagination, we're doing them a terrible disservice. And Mr. Chairman, I would stand for any questions.
Questions for Miss Emily? Anybody? Thank you for your comments. We appreciate it.
Thank you for your time. I appreciate it.
Anybody else, public comment? Nobody online?
No, Mr. Chairman.
All right, public comment goes once, twice. Public comment is closed, and we will now adjourn, or not adjourn, I'm sorry. We'll recess until 8:30 tomorrow morning.